Thank you, Mr. Chair, and good morning. As we haven't had a meeting in some time, I am going to provide a very short review of the protocols for electronic participation in council meetings. This meeting is being live streamed. In order to ensure that this meeting remains accessible to the public, the meeting will be recessed for 10 minutes if the live stream is interrupted or fails. Staff will work to get the live stream up and running as soon as possible, and we will keep council advised. If you wish to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. The speakers list will be determined based on members who have raised their hand using the icon. Voting for this meeting will be conducted verbally. For procedural votes that do not require a recorded vote, the chair or I will call for any objections. If you have an objection, indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. Voting does take a significant amount of time in the virtual meeting process setting. The procedure bylaw requires that all votes are to be recorded except for some procedural votes. The rules could be waived with a 2/3 majority. The recorded votes are only required if specifically called for on a particular item, rather than as a general rule. The chair or I would call for objections, and if hearing none, the motion would carry. I'm in council's hands. If someone wants to make a motion, then we could do a recorded vote to waive the rules, that portion of the procedure bylaw, once the meeting has begun. For recorded votes, I will call upon each member and will confirm the vote for each member. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you are participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We shall now commence with roll call. Mayor Brown.
Here. Mayor Brown is present.
Thank you. Councillor Carlson.
I'm here, thanks.
Thank you. Mayor Crombie is absent and Councillor Parrish has her proxy. Councillor Demerla. Councillor Demerla.
Yes, present.
Thank you. Councillor Dasco.
Hi, yes, I'm here.
Thank you. Councillor Dillon.
Morning here.
Thank you. Councillor Downey.
Present.
Thank you. Councillor Fonseca.
Good morning, I'm here.
Thank you. Councillor Fortini did indicate that he would be late this morning. Councillor Groves.
Good morning, I'm here. Thank you.
Thank you. Councillor Innes.
Good morning. Happy Thursday.
Morning. Thank you. Councillor Kovac.
Good morning. Thank you. I'm here.
Thank you. Councillor Mahoney.
Good morning, present.
Thank you. Councillor McFadden.
Good morning, welcome back, everyone.
Thank you. Councillor Medeiros.
Hi, good morning. Thank you.
Thank you. Councillor Paleshi.
Present.
Thank you. Councillor Parrish.
Yes, I'm here.
Thank you. Councillor Raz.
Here. Good morning, everybody.
Thank you. Councillor Sado.
Good morning. I'm here.
Thank you. Councillor Santos.
Present.
Thank you. Councillor Sinclair.
Here.
Thank you. Councillor Starr.
Present.
Thank you. Mayor Thompson.
Everyone?
Thank you. Councillor Singh for Councillor Vicente today.
Present.
Thank you. We have quorum and can proceed. Thank you, Chair.
Thank you, Madam Clerk. On to our Indigenous land acknowledgement. We would like to begin by acknowledging the land on which we gather and which the region of Peel operates as part of the treaty land and territory of the Mississaugas of the Credit. For thousands of years, Indigenous people inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, Ojibwe, Chippewa peoples, and the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nations, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. Okay, do I have any declarations of conflict of interest? Hearing and seeing none. I need approval of the minutes for July 8, 2021 Regional Council meeting. Madam Clerk, do you have a mover and a seconder?
Moved by Councillor Dillon and seconded by Councillor Groves.
Please call the vote, Madam Clerk.
Are there any objections? And the minutes of the July 8th, 2021 Regional Council meeting are approved. Thank you.
Okay, and with the approval of the agenda, I want to double back to the point that the clerk made a moment ago to see if it was council's wish to deal with it now. As she mentioned, once we deal with our consent agenda, there are a handful of items that in many instances, somebody wants held just for a simple clarification, something of that kind, but it still requires a recorded vote under our procedures. And what the clerk and I were wondering is if somebody would be willing to say, if at the request of the person who held the question, if they're satisfied that it was a simple matter and it can just be voted upon in the normal way so that we don't have to take the time to have a recorded vote for each individual one, that would be helpful. Councillor Rast, did you have a thought on that?
No, I think that's a fantastic idea. It'll help move things along a little bit. I'm very guilty of holding a lot of reports to ask very simple questions that aren't contentious about the item itself. So happy to move that motion, Mr. Chair.
Okay, and I see Councillor Sato next. Councillor Sato.
Yes, thank you, Mr. Chair. I no problem with it. I just would like a clarification. So if that involves motions that are being held by members of council, I would just like assurance that if we do that, that when the motions are passed, that the mover and seconder of the motion are clearly shown on that. Because if it goes through consent, then those names are removed off the motion.
Good point. Madam Clerk, if you can clarify.
That is correct, Councillor Sato. The mover and seconder will be called for, and then no objections. If there's no objections noted, then there would not be the necessity of a recorded vote. It is always open to a member to request a recorded vote, though. So even if you waive the rules for this procedure at this time, if there is a vote that you are wanting a recording for, then at any time, any member can ask for the vote to be recorded.
Okay, thank you for the clarification. I'm fine with that.
Okay, with that, I'm going to accept that as a formal motion now, as moved by Councillor Raz, seconded by Councillor Sato. Now that it is before me, are there any questioners or speakers to that motion? Seeing and hearing none, Madam Clerk, would you like a recorded vote on this?
Yes, I would. Thank you. A recorded vote to end recorded
vote on
votes.
the subject of matters held on consent at the request of the mover and seconder and at the discretion of the chair and the clerk can be voted on in the normal manner other than a recorded vote unless requested. I'm going to call that vote now. All in favor of that. Madam Clerk, for the vote, over to you.
Thank you. Mayor Brown? Mayor Brown?
Yes. Can you hear me? Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Councillor Parrish for Mayor Crombie?
Yes.
In favor. Councillor DeMerla?
Yes.
In favor. Councillor Dasco? Councillor Dasco?
Can you hear me?
I can hear you now.
We can.
Councillor
Go ahead, please vote.
Councillor Dasco, how's your vote?
You can hear me or not, but yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes. In favor.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
In favor.
Councillor Medeiros in favor. Councillor Paleshi.
In favor.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Mayor Thompson.
In favor.
Mayor Thompson in favor. And Councillor Singh.
In favor.
Councillor Singh in favor. Thank you very much. Carries unanimously. Thank you.
With thanks to all for keeping our business moving along, and in particular for the clerk for bringing up that very clever suggestion. Thank you very much. Okay, that brings us to the consent agenda. Several delegations, our update on COVID, the Integrity
Mr.
Commissioner's
Chair, if we
report.
could circle back and approve the agenda for today's
My
meeting
apologies.
first. Thank you.
So the approval of the agenda as presented. Madam Clerk, you have a mover and a seconder?
Councillor Fonseca and Councillor Paleshi.
Wonderful. Please take that vote.
Any objections to the agenda as printed? Seeing none, motion carried. Thank you.
Thank you. So I'm on to our consent agenda. The first item that I come to is item 12.1, items related to enterprise programs and services. 12.1, budget policy and reserve management policy compliance update here for information. Do I have consent? Consent, thank you. Communication items 13.1, Amber Lapointe, Clerk, City of Point Cobourg, item with regards to capital gains exemption primary residence. On consent?
Mr. Chair, sorry, I had asked that those be held, but they refer to my motion.
Yes.
So we don't need to hold those.
Understood, and I know we will be coming to your motion in and of itself. Yes, Councillor.
Right, and all
Sable.
the correspondence on that issue, I have no problem with it being on consent.
Very good, thank you. So if nobody else with regards to 13.2 and 13.3 is the same matter, I have consent for 13.1, 2, and 3. Very good, on consent. 13.4, from the Minister of Municipal Affairs, Minister Clark, regarding the Audit and Accountability Fund Intake Program. On consent? Thank you. 13.5 from the Minister Sylvia Jones, responding to a letter from myself, the regional chair, regarding First Nation evacuees. On consent, thank you. Item 14.1 under Public Works, noise wall petition for DeRose Avenue, Town of Caledon, Ward 5, here for information.
Mr. Chair, I'd like to hold that. It's Councillor Groves, and I do have a motion that I sent over to the clerk yesterday that I worked on with staff.
So 14.1 is held. 14.2, Toronto and Region Conservation Authority and Credit Valley Conservation Environmental Assessment and Permit Review Service Agreements. On consent, 15.1, communication items. Laura Hall, Director of Corporate Services and Town Clerk for the Town of Caledon, a letter with regards to a petition from residents on DeRose Avenue, the related matter that Councillor Groves wants held. On consent, 15.2, from Richa Ajitkumar, Acting Legislative Coordinator, City of Brampton, resolution requesting that the Region Appeal staff update the detailed design work on Beauvais Drive west of Mississauga Road for a referral to Public Works is what is recommended. Do I have that on consent? Very good. Moving on to 17, communication items. 17.1 from Minister Christine Elliott, letter with regards to the 50/50 land ambulance service grant. On consent? Thank you. 17.2 again from Minister Elliott, advising of one-time funding for 2021-22 to support the offload nurse program. Receipt is recommended. On consent? Thank you. Minister again, Elliott, letter advising of one-time funding for the support of the provision of public health programs and services, also receipt recommended. On consent? Thank you. And 17.4, briefing and correspondence unit, Corporate Secretariat, Women and Gender Equality Canada, on behalf of Marion Monsef, Minister of Women and Gender Equality and Rural Economic Development, regarding sustainable fundings for victims of family violence, also here for receipt. Do I have that on consent? On consent. Thank you very much. 19.1, letter from Minister Clark with regards to advising of the 2022-23 planned funding allocations for provincially delivered housing and homeless prevention programs here for receipt. On consent. Thank you. I have a notice of motion that we will deal with then. Off to the in-cameras then. So let's deal with the in-cameras to see if some of them need not be dealt with at all or in camera. Item 13.1 is the session report. So with regards to the minutes, item 13.1, 23.1, my apologies, 23.1 under in camera, the minutes of the previous meeting. Do I have consent for 23.1? Thank you. 23.2, payment of compensation pursuant to expropriation acts regarding Beauvais Drive West to Mayfield Road. On consent. Thank you. 23.3, collective agreement negotiations, labor relation or employment negotiations. I believe we need a report on that. So 23.3 to be held. I believe 23.4, the National Day of Truth and Reconciliation. We're getting an update on that. So that too is to be held. 23.5 in camera, the Rapid Housing Initiative. Do I have consent? On consent, 23.6, letter from the Director of Social Service Assistance Delivery Branch, Ministry of Children, Community and Social Services, with regards to a Crown agency comments to us. On consent? Thank you. 23.7, letter from the Minister of Municipal Affairs, information related to, again, communications from a Crown agency. 23.7, on consent. Thank you. 23.8, letter from the Chair of the Green Municipal Fund Council with regards to, again, information coming from a Crown agency. On consent. Thank you. And finally, 23.9, again, from the Chair of the Green Fund, information coming to us from the Federal Crown Agency. On consent? Very good. Madam Clerk, there you have it. Can I have you take the vote on the consent agenda, please?
Thank you. If I may, there actually is no presentation on 23.3. So if there is no need or any questions, that could go on the consent agenda as well. Are there
let me
any?
put that more properly then, Madam Clerk. Thank you. I see Councillor Sato waving. Councillor Sato, I got ahead of myself. Yes, 23.3, it's asked to be held by Councillor Sato. My apologies for getting ahead of myself. Thank you, Madam Clerk. So we will include 23.3 to be held on consent. Thank you, Madam Clerk. With that, for the vote on the consent agenda, over to you, Madam Clerk.
Thank you. Mayor Brown? Mayor Brown? Councillor Carlson?
Yes.
Councillor Carlson in favor. Councillor Parrish for Mayor Crombie?
Yes.
In favor. Thank you. Councillor Demerla?
Yes.
And Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini, are you here? Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, thank you.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes, in favor.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos? Councillor Santos? Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Singh?
In favor.
Councillor Singh in favor. Thank you.
Thank you, and thanks to all for our consent.
Second, it's Mayor Brown. I just want to make sure you heard my yes.
Thank you, Mayor Brown. We'll record you as in favor. Thank you.
Councillor Santos as well. Did you get my yes?
Councillor Santos will record you as in favor as well. Motion carries. Thank you.
Thank you all. With that, we get to the agenda under delegations, item 7.1. Balraj Kanlan, co-founder One Voice Canada, and Puneet Dhillon, manager Punjabi Community Health Service, regarding social problems related to the mismanagement of the International Student Program. Welcome to the delegates, and I remind you, you have a 5-minute time limit on your presentation. So over to our delegates, please.
Yes. Hello, everyone. So I guess unless there's any questions or comments to start, we can jump into the presentation.
Please do, yes.
And so, Puneet, you can start us off.
Hi, everyone. I hope you can hear me all good. So this is Puneet. I'm the Manager of Communications and Research working with Punjabi Community Health Services. And I will present the first 3 or 4 slides, and then thereafter, Balraj will take on. So if I can please move to the next slide. I request the host. Yeah, so as we all know that international students have become part of our culture, part of our society, part of our communities, and even part of our economy. So we must know the problems which they are encountering with, because we as social service provider do come across so many problems, so many issues and challenges which these students have been facing. It's not that this is just has been produced by one reason. There are many reasons, including the cultural reasons, including the weather conditions, the novel state they are in, the new country, and everything is so new. So that's why there are certain problems which needs to be brought to the attention of the council today. So first is the housing issue faced by the students. I do not know, but somehow I'm seeing the presentation slides as blur ones. So I will open my own slides on the side and then continue with my presentation. So the research says that 20% of survey respondents in international students indicated that they have been living in overcrowded accommodations. So there has been the problem of overcrowding or living in illegal second units in the region of Peel, including Mississauga and Brampton, where these international students have been putting up after they arrive from their home country. And then if I move to the next slide, then there's definitely a labor exploitation and an underground economy which is affecting the international students. There have been many students who experience labor exploitation, have not been paid or paid below the minimum wage. And these students will not often report to their employer because they fear jeopardizing their chance of getting their PR and settling down in Canada. If I move to the next slide, it talks about the suicide and addiction problem the international students have been facing. The survey has found that 9 in 10 students are concerned about their expenses, 6 in 10 students suffer from their poor well-being, and 10 publicly reported suicides of international students, and 4 were in the region of Peel. So we even coordinated with Lotus Funeral Center, who receives 4 to 5 international student death cases per month. The concerns in drug overdose suicides may be responsible for the higher number of deaths. So I, as a representative of PCHS, must also want to acknowledge that our CEO has met 4 psychiatrists in the Brampton Civic Hospital, and they have expressed that they are overwhelmed with the stress and mental health issues among international students. So this is becoming a major health crisis in the region, because these students, due to so many other pressures, due to housing issues, due to economy, due to change in weather conditions, and due to a novel country they are facing, is causing so many health and mental health issues among these students. So thereafter, to the next slide, I will have Balraj present on them. If Balraj can take it from here, please.
Yeah, so many female international students are vulnerable to sexual crimes. Financial and housing insecurity are some of the causes of sexual coercion and exploitation, and abuse victims are often economically dependent on their abusers, or landlord or employer. Next slide. So now I just want to quickly explain, help you understand why these problems are occurring. First, important to understand that colleges partner with a disreputable industry to recruit international students. Listed here are 2 prominent reports on the topic, so you don't have to take my word for it. And the result is that colleges are recruiting in many students who are misinformed or ill-equipped to study in Canada. Next slide. This graph just quickly shows shows that international students pay almost 5 times higher in tuition fees, which is a great source of stress. Next slide. So multiple federal government studies have found international student graduates have worse economic outcomes compared to Canadian citizens. The largest difference is in the field of business management and public administration, which also happens to be the most popular field of study for international students. So the claim that the international student program as currently designed is effective at meeting skilled labor needs is unproven. Next slide. Many private colleges cater to international students. Ontario has over 700 private colleges, of which a quarter of them are located in the Peel region. So a key question to ask is, are these colleges making the poor economic outcome problem for international students even worse? Next slide. So the government cannot claim to be ignorant about these problems associated with international education. In 2015, Immigration Canada conducted an evaluation where they found problems or concerns of fraud and misuse. In 2017, the House of Commons Committee studied the vulnerability and exploitation of international students and other migrants. And a story that got some attention in 2018, Niagara College had to retest 100 international students because they were struggling due to poor English skills, which raised the question, then why did they recruit them in? They didn't do right by the students. Next slide. So it is worth noting that international education is contributing to a bigger problem we have with how immigration is being managed in Canada. This is because immigrants have been found to earn significantly less money than Canadian-born workers. Recent immigrants have higher rates of poverty, and immigrants experience declining health in Canada. Given Peel region's high immigrant population, the continued mismanagement of the international student program may be hindering the Peel poverty reduction strategy, which is currently in place. Next slide. So just to end, this issue is in desperate need of some political leadership. And I have provided our 3 recommendations, but right now we are just asking the Peel Regional Council to advocate to the federal government to review and reform the international student program. And just to finish off, I guess, many nonprofits have been trying to deal with these issues for a number of years now, and we feel that the status quo should not be acceptable, and we hope you feel the same way. Thank you for your time. Happy to hear any questions.
Balraj and Puneet, thank you very, very much for your presentation. I do have questioners. I have Councillor Parrish, then Councillor Santos. Councillor Parrish.
So much have questions. I first of all sympathize with the presentation. It is a terrible state of affairs. We feel it heavily in Malton because a lot of these kids are jammed 8 or 10 in a house. I had one complaint where there was one house that had about 14 kids in it, and they were using the backyard as a washroom because they only had one in the house. So this is exploiting young people, especially foreign students. It's completely wrong, and I think we should be doing something more about it than what we're doing as a region. I found the chart on fees for universities interesting in that the red bars are the actual costs for students. I can remember when I was in Ottawa, we went through all this. The taxpayers of Canada are putting in the money to subsidize our students, but they don't subsidize foreign students. So those red bars on that one graph are the actual costs of going to university. So that's a reality. There's nothing much we can do to change that. But I thank you very much for your presentation. It's a wake up.
Thank you. Councillor Santos.
Thank you so much. And through you, Mr. Chair, to PCHS, thank you so much for coming to delegate today. I just wanted to give a heads up as well that PCHS, as well as Indus Community Services and the Davis Center for Families came in to Brampton Council yesterday to delegate and also gave a presentation. And in fact, Indus and PCHS are coming forward with a report in the very short while, providing more details about the crisis with international students across the country, but specifically in Peel. And I was wondering from PCHS's perspective, I know that there was mention on the private colleges, but as we all know in Peel, there are quite a number of public institutions as well, which pretty much make up a significant amount of international students as well. If you could comment on, what the collaboration is like with those institutions to help address some of these problems, and also how we can better utilize these public institutions who do have capacity to deal with some of these issues better. And then finally, if PCHS, if you could comment on the housing side of the public institutions, because I recognize that there's an issue with the private colleges, but it's really difficult to pinpoint where those private colleges are. And really a big piece of the pie for international students are still, they still go to school in public institutions like Sheridan, like Algoma, like U of T, for example. If you could comment on that, that would be great.
Thank you, Councillor Santos. I will take that, Balraj. So for PCHS, we are working in collaboration with Indus on international students and their issues. And with due respect, a large pie of international students does go to public colleges. For example, the college, Sheridan College, has more than 6,800 international students right now, which has been published. So we are definitely working on the issues and we are trying to collaborate with. Unfortunately, we did meet one of the representatives from Sheridan College lately, but there was no results as yet. But we are looking forward, if the problem is acknowledged, if the problem is well put in the form of a problem, then we can look into the issues as well. Because right now we are juggling with the problem being accepted as a problem, because as they say, like when we put a problem in a well words, it is half solved. So right now the denial and the acceptance of the issues has become one of the bigger challenges as well. We are trying to coordinate, we are trying to work on the issues, and we are also trying to get hold of like other communities and other partners who can support us in this issue.
Thank you so much. Thank you, through you, Mr. Chair, and thank you very much for that. I mean, like, one of our big problems, as we discussed and as you mentioned, is the denial. Like, I find that the public institutions are saying, no, we're doing enough, and we're the ones who are doing everything on this. And but the reality is that if they are, and if they do make a significant portion of international students, then why is the issue getting worse? And so I think there needs to be a level of acceptance and acknowledgement that the public institutions really play a leadership role in this, because if they cannot play a leadership role, if they're not collaborating with our agencies, then certainly how are we going to manage with the private colleges? And so I make that point up, and next week at Brampton Council, we will be bringing forward a motion. And what I might do is I might refer that motion as well to Regional Council for our consideration as well. Thank you so much for delegating.
Thank you, Councillor Innes.
Thank you. Thank you for delegating. It's not so much a question, but perhaps a request of staff. Could this be referred to the Government Relations Committee as an opportunity for our quarterly discussions with our MPs and our MPPs? I think that it's valuable information. I think that our staff can take this presentation that was provided today and provide the impacts and the resources that are being allocated from Peel Region, and perhaps some suggestions on how we could partner better with the federal government and even our provincial partners, Ontario's training colleges and universities. And so I think that is a wonderful opportunity for Peel Council to advocate to our MPs in particular in regards to this matter. And I would really like to see that come back. I don't think it probably needs a resolution. I think it could be just a request, but I would hope that we could see that, and perhaps it could be at, if not our next one, the one after that, so we can get it in this calendar year. That would be appreciated. Thank you, and thank you for coming and present today.
Certainly taken as direction for our upcoming meeting with our MPs and MPPs. Well thought out, Councillor Innes, Chair Innes of the committee. Thank you. Councillor Sato.
Thank you, Mr. Chair, and thank you for your deputation today to both of the presenters. It's always very disturbing when we hear of anyone being treated such a way. So I sit on the Economic Development Advisory Board of the City of Mississauga, and on that board we have Sheridan College and UTM. And over the many years that we've been working with this board, they have pointed out to us and outlined all of the supports that are in place for foreign students. So I'm disturbed today to hear comments that they are not providing those supports. And I will be asking our Economic Development Board to gather more information on that, because the foreign student issue is very important to the economy of the city of Mississauga and, of course, the region of Peel. And it's an area that we've had much discussion on at those board meetings. One of the other concerns, not concerns that I have, there was a comment. I mean, some of your recommendations, quite frankly, I don't think have anything to do with foreign students. Fluoride has nothing to do with it. So I was kind of surprised that was in there. But I would like to see staff, not just referring it to governance, but I'd like to see our social services staff come back and comment either publicly or by an email to members of council, as one of your slides referred to the fact that the impact on the region of Peel was an impact on our poverty reduction program. And I would like to get more feedback from staff on that. I don't know if they want to respond to it today or if they want to take time to take a look at their comment, because we need to really take a look. We can be advocates, which I think is important, but we also at the same time need to take a look at what the impact is on us at the region of Peel, because that's where we can actually show. When we do our advocacy, we always do a business case, and we need to have that information. So I would like to see that before we decide to take any advocacy, because if there's no impact, it's very hard for us, except from a moral perspective. And I would like to see us do more than that to make it stronger. So, Mr. Chair, if I could move that it be referred to social services staff to take a look at the comments that were made and to report back to regional council, and I will leave it to them how they report back. Thank you.
Councillor Sato, I think that is a great idea. I was thinking the same thing, because the students, and good on you for being here and telling us, but when they went very specific on an excellent presentation that spoke to their concerns, number one, colleges misinforming about the programs. Well, we're not responsible for the colleges. Number two, tuitions are 5 times more. The region of Peel doesn't set the tuitions. And number three, the programs maybe don't equal the skills that are out there. We don't set the programs. But what we do deal with is social services for anybody that requires them. And I think that's where we can have our interdiction. One last point I would make is I hope, following this excellent presentation from Balraj and Paneet, they tell me there's a federal election on. This is your best time in the world to be advocating to us, but to the people that are actually responsible. So I will leave that thought with you. I'm sure you're doing that as well. Commissioner Sheehy, you had a thought on Councillor Sato's point.
So thank you very much, Councillor Sato. And I just wanted to assure you that we were planning to follow up on this presentation anyways. There are a number of supports that we do provide to students and international students, but we want to better understand both the issues and the challenges that are being faced. And we will also be following up with Sheridan College to try to build awareness on those supports that we do provide in the region.
So, Mr. Chair, given that, could I then make my referral that that the commissioner report back then directly to council, so that we can get a report back before we do anything? I think we should see that report.
Very good.
Thank you.
Yes, I would take that as direction, Commissioner, to come back to, and as I say, Councillor Sato, bang on. What is the impact to us at the regional level? And that's the business we're in, and I think that's very, very appropriate. One last thing I would mention, and of all folks, my son, very proud dad, as he was just graduating a few months ago from U of T, he mentioned about the plight of the foreign students at U of T and various. One thing that I want everybody to keep in mind, I learned that apparently 60 to 70% of what we call a foreign student end up staying in Canada and contributing to our economy. So the overwhelming majority of these individuals become our friends, our colleagues, other Canadians with great educations, because we're proud of our education system. certainly we've got to support the people that are going to build the Canada of tomorrow. So that's another perspective that I'd like to add as well. In addition to thanking Balraj and Puneet for your excellent presentation, Councillor Sato, thank you for your recommendation. That is taken as direction. Councillor Parrish and Councillor Sato, if you would move receipt of the delegates.
Chair Unique, if I could interrupt, Councillor Dillon would like to speak as well. He doesn't have.
Councillor Dillon, please go ahead.
Yeah, sorry about that. I had put my hand up. I'm not sure if we have to email or if we put our hands up now. So I appreciate the opportunity to speak. And I know Councillor Santos had mentioned that we're going to be discussing this issue next week at our council. And I think she mentioned that it's going to be referred back to the region potentially. And Councillor Innes had mentioned it'll be discussed at government relations, and Councillor Parrish moved that we're going to have Commissioner Sheehy report back to council. So I think these are all great steps. And I think, and I know Councillor Singh is here as well today, and something that we're pretty familiar with, and I think Councillor Parrish can be familiar with as well, just because it's a big problem in Malton too. And we discussed yesterday the plight in our council, the plight of the international students. And a lot of these kids, I would say the majority of the kids, I was reading a report, come from the Punjab region in India, from, well off, not well off, but good homes. But they have to sell off, their land or do whatever it takes to get their kid to Canada. It's unfortunate the situation they're put in. And we talked about a whole variety of some of the issues that they're going through. And I've had a conversation with a few of them, a number of them. And it's, where do we, kind of look to? Do we look at the feds? Do we look at the province? A lot of the issues they have in terms of, for example, accommodation falls on our lap. We have, a big issue with lodging houses. I remember one was 24 kids in one house, and the environment, the situation they live in isn't always the best. They're forced to work max 20 hours. One kid, he was just trying to get by, paying his tuition. He was working truck. He went a couple of hours over the 20. He was deported, and so the federal government's allowing them to come here. The provincial government sets the rules in terms of the post-secondary education, but there's really no cohesion in terms of how we support these kids. And Baldev Mutta from PCHS was saying, listen, we should offer them the same immigrant support services that some of these newcomers get as well. So I really do hope we can, yesterday we were saying we can hope we get everybody at the table, and hopefully through government relations or whatever channel that we decide, we can really get on the same page, everybody, and support these kids. Like I said, they're here to get an education. Sometimes they're forced to go down the wrong path, and unfortunately, some of the girls have turned to prostitution. It's very, very sad, and it just breaks my heart. And I'll finish off with one story. There's a girl who and used to come to somebody's house who I know every morning, because they used to sing hymns. She's like, can I come over? And she'd start coming over, and they're like, where do you live? Why do you come here? She's like, well, I was forced into prostitution. I have nowhere to stay. And I thought I can just, get the company of you guys while, your street and, your neighbors come and do these hymns every morning. And so they had more discussions. The guy looked into it, and what he said was, listen, this is an issue that's bursting at its seams, and we need to address this as quickly as possible. So I really want to thank the delegates for coming in. There's so many stories similar to this, but I'm hopeful we're able to find some type of solution, some direction in which we can help these kids. At the end of the day, they're coming here, they're contributing, they're paying tax, and we want to make sure that we guide them in the right way. Thanks, everybody.
Thank you. Last call for other speakers. I see none on my list and have not been made aware of any others from the clerk. So with that, receipt and referral has been moved by Councillor Sato, seconded by Councillor Parrish. Just a simple vote, I would think, Madam Clerk. All those in favor, are there any opposed? That is carried, again with our thanks to the delegates. That brings us to delegation number 7.2, Gurmeet Kaur, resident appeal regarding mask bylaws and medical exemptions in Peel. Gurmeet, welcome, and I too remind you of the 5-minute time limit. Please proceed.
Everyone, thank you for the opportunity to present this very important issue.
Gurmeet, you sound a little faint. If you can turn your volume up a touch, please, or speak closer to your microphone. Please proceed.
Am I audible now?
That's better. Go ahead.
Thank you. So yeah, thank you so much for the opportunity to present this very important issue. Actually, I would say this time has been challenging for all of us. The pandemic has affected every single individual's life one or another way. I have seen people often saying to each other that we'll get through this together. But honestly, society doesn't seem to be sticking to this promise. Like many others, I have been segregated at many places because of my health condition. I have had severe bronchitis since childhood, and I have already a heavier and abnormal breathing than other people. And with mask on, I am not even able to breathe for 5 minutes or more. And I immediately start breathing shortness of breath and anxiety, so I was advised by the doctor not to wear mask. But being exempt from the mask, trust me, isn't easy. The discrimination I have faced because of this has cut me off from the people, and it takes a great toll on my emotional and mental health. Starting from my previous workplace, I was not allowed to work without a mask. They did not honor mask exemption at all. After seriously struggling and trying to work with a mask on for so many days and making my body suffer, I had to give up. I said, I cannot work. Eventually, I was given a separate section to work away from everyone else where I didn't have to wear a mask. The stigma and alienation I felt was humiliating and incredibly hurtful. People would pass by and give me hateful comments and give me disrespectful looks just because I wasn't wearing mask. It was all because there was a probability that I could spread COVID. They would assume that I'm infected, but they didn't think, and there was no sympathy that I had a medical condition because of which I couldn't wear mask. And if I wear one, I would surely die. There was a difference between probability and surety, but still I was being discriminated on this basis. And strangest thing which I faced there was that I wasn't allowed to have lunch with my colleagues. Everybody would remove their mask while eating and have lunch, but I wasn't allowed to be a part of that because they said you don't wear mask. So soon after that, the workplace stopped accommodating my mask exemption again, and I was moved back to my original role, and they'd call me in every second day and say, we don't know, do something, mask up. I had to leave. And same thing happened at another workplace. So I have by now changed 3 jobs because of this, imagine. I'm simply trying to earn a living, work hard, and take care of my expenses. This is how I'm treated. No respect, no humanity for someone with a disability. It's been extremely stressful and demoralizing, constantly having to look for and change jobs, not knowing if I'll be able to pay my next bill or rent or anything. I'm a hard worker. I give my best. And just because of my medical condition, I am discriminated from earning basic living. In addition to that, I would like to state I use public transport. And while traveling, I'm allowed by law to board a bus with my mask exemption. The driver served me with a smile. Except a few. A driver asked me to wear a mask, and I told him that I'm exempt. He said, stay home then. Why are you putting others at risk? I have one question for everyone who asks me this question. You are wearing your mask for your safety. How come me not wearing my mask puts you at other risk? It's so much like I'm having my umbrella on during rain, and you're saying me that if you don't open your umbrella, mine would work. Doesn't make sense. Who would think for staying home? Another driver on my way didn't even open the door for me to board the bus. He said, I was a regular passenger on his bus. He said, then he opened the door after a few seconds and said, don't step in the bus. Show me the proof that you're exempt, because somebody has complained to my way that this girl boards the bus without mask. I'm surprised that my way allowed him to do that. Didn't they tell him that according to PIPEDA, it's illegal to ask my medical condition and proof? That's the invasion of privacy. I had to tell him my medical condition just to board the bus. And that was such a violation of my dignity and my rights. These experiences are not unforgettable. I'm seeing this on daily basis. It's traumatic, sorry. Being discriminated by passengers, shoppers, pedestrians, colleagues, friends, and whom not is so depressing and emotionally damaging. I feel exhausted and burnt out after every time I feel myself being discriminated. And to support my exemption and prove that I'm not a harm to the society, I would like to state the example of Sweden. They never mandated masks over there. According to the report of Insider News on July 1st, in fact, the people wearing masks said that we are looked upon as outlanders, as we're doing something strange.
Gurmeet, you have 1 minute left to sum up, please.
Yeah. Okay, I'm concluding. So to conclude, I strongly recommend to the respective authorities to honor the mask exemption and to make sure that every service provider is staying true to the law by honoring the exemption and making people aware so that they don't make the medically disabled feel left out because of their condition. I will go as far as to say people look at the evidence and human rights and compare to other jurisdictions. Make masks voluntary, not mandatory. This will help us combat this stigma. Please stop people from policing my or anyone else's body. We all deserve inclusion, fairness, dignity. I'm really looking forward for a positive change in field.
Gurmeet, thank you for being here, and you've expressed yourself very well. I would like to call upon our Medical Officer of Health, Dr. Lawrence Loh, to perhaps address some of the practical day-to-day problems that you raised. Dr. Loh, your thoughts, please, on the issues that have been raised.
Thank you, Mr. Chair, through the chair to council and the delegate. I think the question around the mask mandate is an important one, and the scientific basis for the masks in terms of preventing spread, particularly from individuals who may be asymptomatic with the COVID-19 infection, has now been borne out very clearly through data that's been acquired over the past 18 months. And I certainly empathize and sympathize with the challenges faced by the respondent. My opinion, however, Mr. Chair, is that many of these issues concern labor rights issues, at least in respect of the workplace, and also medical issues that should be discussed with the individual's primary care physician. At a broad level, underlying respiratory disease is not a contraindication against mask usage. We know that individuals with severe emphysema have been studied with masks, and there has not been any impact of their gaseous exchange. And these are people with really severe end-stage emphysema that have been studied. So I think there appear to be matters here that for the individual, I think, to take up as it pertains to workplace regulations and as well as their own personal health information and an assessment by their primary care provider. Thank you, Mr. Chair.
Dr. Loh, thank you. Do I have any questions of the delegate? I see none on my screen. Seeing none, if I could have receipt of the delegation from Councillor Starr and Councillor Fonseca. Any opposed? That is carried. Gurmeet, thank you very much for your presentation today. Moving on, item 7.3, Delegate Anit Sidhu, resident appeal regarding implications of mandatory vaccination certificates. Anit, please, and you too have 5 minutes.
Good morning, all the members. I would like to thank you for the opportunity given to me to speak today. Sir, as a father, a husband, and a human being, I'm really concerned about the implementation of vaccine passport or certificates. I understand that COVID has been a challenge for all of us, and we all want to be over with it. But the vaccine passport and the creating two-tiered society are not the ways. Are we considering how this will create exclusion? Why are we going back to the era of show me the papers? It is necessary to take a drastic measure that violate human rights. Telling people that they cannot go to a restaurant or a sporting game if they are not vaccinated is not incentive. In fact, it's a coercion. It is threatening people to comply or else they will get punished. this is not a free informed consent. I never thought I would see this in Canada ever. This will harm families. I always teach my kid to be respectful to all the people and respect their choices because we all have different choices. I'm confident that you teach your kids the same thing. What kind of divided world we are leaving for them? I thought we are trying to fight discrimination like racism, but at the same time, we are creating a new dangerous discrimination where vaccinated human beings are seen as dirty, bad, and subhuman. We have some of the highest vaccination rates in this world. If the vaccine worked, then why should there be a fear of unvaccinated? Why do we assume that because of someone unvaccinated, they are default infected by COVID? Study shows that even vaccinated can transmit COVID. So how will vaccinate passport surely stop the spread? How can we soundly justify exclusion and violating rights of unvaccinated when vaccinated and unvaccinated can both spread the virus? I lived through the years of Sikh genocide and extrajudicial killing of Sikhs in India, where innocent Sikhs were hunted down and killed just for being who they are. The media, politicians systematically dehumanize the Sikhs and position Sikhs as our enemies and threat of fear. The great country we live in, Canada, is a place where we could work and raise our kids, our families, and participate in society with freedom. But I am now seeing us move into a dark age. I know that what happens when society promotes hate and fear against any group. I recently see a article published in Toronto Star, which reads, "I have no empathy left for willful unvaccinated. Let them die." I was really shocked and horrified when I saw it. I could not believe this. How are we openly allowing hate speech against human beings? Where is the outrage for this now?
Anit, 1 minute left, please, for your conclusion.
Yes,
1 minute more,
I'll be
please.
quick. And recently, a 13-year-old boy was not allowed to a walk-in clinic in Vancouver, British Columbia, because he was unvaccinated. This is a discrimination that consequences of vaccine passports are severely and will lead to a creation of a second-class citizens. This has a dangerous similarities of what we saw during Nazi era with the Jews and apartheid in South Africa. Without a doubt, vaccine passport will divide society. Those who choose not to be vaccinated, which is their fundamental right, will be segregated and denied a normal existence. They are being vilified in the media, and this will lead to their persecution. The World Health Organization itself does not support the vaccine passport. There is a growing group of strong, compassionate people fighting for all of our rights. We all are one people, and we respect the choice and rights of everyone. We must not let fear divide our beautiful and diverse community. I trust you also believe the same. I ask you to do the right thing and strongly oppose vaccine cards immediately. Fight for the people and for our future generations. It is our duty to safeguard human rights for everyone. Thank you so much for the opportunity you gave me to speak here, sir. Thank you.
Thank you very much. To my council colleagues, I have one more delegate also here on the matter of mandatory vaccines. What I'm going to suggest is we're going to move receipt of this delegate, hear the next one, because next up is Dr. Loh with his presentation, and perhaps Dr. Loh will speak to this item to address the delegate's concerns and then carry on with his report in the interest of moving on. So if I have no questioners of the delegate, I'm going to ask for receipt of the delegation from Councillor Dasco, seconded by Councillor Ras. Anyone opposed? If not, thank you. Then our final delegate on the matter regarding implication of mandatory vaccines is Harpreet Singh. I'd like to receive his delegation at that time if there are no questions, and then write to Dr. Loh to address this and everything else within his report. So with that, delegation 7.4, Harpreet Singh regarding implications of mandatory vaccines and how to preserve human rights. Harpreet, 5 minutes, please. Go ahead.
Hi, good morning. Just wanted to make sure, can you see me and hear me properly?
Yes, we can. Please proceed.
Okay, awesome, awesome. Thank you so much. Good morning, everyone. First of all, thank you for giving me an opportunity to speak and express my concerns through this platform. So today I'll be talking about mandatory vaccines and their consequences. As we're all aware, in hope to end COVID-19, governments around the world have started to mandate vaccines on their citizens. But in this process, we are knowingly or unknowingly ignoring and or crushing basic human rights such as one's sacred religious spiritual beliefs, their medical exemptions, or just the basic right to informed consent and choose what goes into their body. I personally know people who have suffered serious side effects following the vaccine. According to the official VAERS report, so far approximately 14,000 people have died. 600,000 side effects have been reported, among which 85,000 have been serious side effects following the COVID vaccines. This is in US alone. Keep in mind, VAERS is known to underreport cases. A CDC whistleblower in a lawsuit claims a separate system which shows the death toll from the vaccines could be as high as 45,000. We rarely hear about this side of the story in the media. Are we still going to force vaccinate people against their will, knowing these stats? There are many world-renowned doctors and scientists whose research findings don't align with the mainstream narrative. Are we going to force vaccinate on them too just because their research contradicts the mainstream? True science is always evolving. Instead of having constructive debates, we are seeing any critique of the mainstream narrative being censored or ridiculed. Australia has recently deployed the army to force people indoors as if every human being is a ticking COVID bomb. How can we stay silent when our fellow human beings are living under such draconian measures? Politicians, media, and corporations are openly and shamelessly using coercion tactics such as giving away hamburgers, marijuana, lottery tickets, and scholarship to manipulate the public into taking this experimental vaccine. Remember, the vaccine human trials will only end in 2023, and there are no long term safety studies. There are also those who are illiterate or are unable to understand medical terminology to make a fully informed decision, such as refugees and elder immigrants. I'm hearing of kids being vaccinated without their parental consent. People are being asked to vaccinate or lose their job that they have been working for as long as 40 years. Imagine your loved one or neighbor suddenly being forced to take an experimental vaccine in order to travel or to go to college or university or to keep their job. Is it justified to suddenly force someone to take a vaccine that is against their beliefs, their practices, or health? What crime did they commit to be casted out of society and ripped off their basic necessities? Aren't we creating a split society where some have more privileges than others? It's no different than having a different section on the bus for the whites and blacks, different rules for the Nazis and Jews. By supporting mandatory vaccines, we are fueling division and hatred among each other based on our health status and choices. Just 2 weeks ago, a friend of mine was threatened to be killed by someone on social media who didn't like that he raised concern about human rights violations with mandatory vaccines. This is serious. Family relations are being torn apart because of one's vaccine status. There's a division being created that I've never seen before in my life, but I'd only heard about happening in Nazi Germany. Whatever is happening is unethical and dangerous. I'm seeing violence happening in the coming days. Lastly, we are seeing that Israel is the most vaccinated country in the world with now the highest COVID infection rate. Stats from a US county showed vaccinated people are just as likely to spread COVID as the unvaccinated. Please take a moment to contemplate these emerging facts. Are forced vaccinations on free human beings robustly justified? It's high time we break the cycle of fear and take a stand against these divisive policies. We must come up with practical evidence based, reasonable solutions where rights and freedoms are protected. Will you stand up for the human rights? Thank you.
Harpreet, thank you very much for your presentation. As I said, I'm going to have Dr. Loh speak to them in a moment, but I did want to say, as I first asked Councillor Fonseca and Councillor Sato to move receipt, and second of the delegate, everyone in favor, no objections, thank you. I really want, on behalf of Council, reach out to Harpreet, Anit, and Gurmeet and say, Thank you for the very dignified, professional, civilized way you've presented yourselves today. We don't always agree, but I'm so proud as chair and on behalf of all my counselors, the manner in which you've presented yourself that we can have an honest discussion about things. So I give you a great deal of credit for that. As I said, Dr. Loh, I'm going to ask to speak to it in his presentation, but there may be a question that's come up. Councillor Singh.
I just wanted to say I do have a huge problem with the comparison between Nazi Germany and also segregation. I think that's totally false equivalence, and I don't think that was dignified. Thank you.
And Councillor Singh, thank you. And there were some other parallels that maybe I, as chair, might have stepped in on as well, but your point's well made. Thank you. Okay, with that, we've had receipt of all the delegates. Moving on.
Sorry, Chair, Unica, it's Councillor Dillon. I just want to add one quick thing.
Please go ahead.
And I just want to apologize earlier before the delegations. I used the wrong terminology. I should have used human trafficking, and I just want to let my council colleagues know I want to apologize to them, and I thank Councillor Downey for pointing that out. Thank you.
Okay, thank you, and duly noted. Thank you. Okay, with that, we've received all of the delegates, and as promised, our next presentation, item 8.1, is an update on the Region of Peel response to COVID-19 from our Medical Officer of Health, Dr. Loh. And Dr. Loh, as promised, could you please take the first few moments to address the delegations that you've heard with regards to the matters that were raised. Dr. Loh, over to you.
Yes, thank you, Mr. Chair, and thank you, Council, and thank you to our delegates for attending today. I actually really appreciated the opportunity to hear from our members of our community in respect of some of their concerns around vaccine certificates and also their interpretations around the nature of the vaccine intervention itself. I think it perhaps important for me to clarify a few facts and inconsistencies that arose from those, and also to really first of all say that I fully empathize. I understand you have concerns. I understand you have questions, and I want to reassure you that the vaccines are certainly safe. They are effective, and if there's any way that we can ensure that you have your questions and concerns around any aspect of the vaccine itself, I would encourage you certainly to seek out opportunities to discuss with your primary care provider or to visit a Peel Region vaccine clinic. We know that the pandemic has been difficult and stressful for everybody, but I really want to provide some clarifications to the presentation to underline why it is my belief in the data and evidence that shows that vaccines are the best way to protect yourself against this novel coronavirus. So I think there's lots of questions, and it is very clear around the vaccines itself right now that they are incredibly effective at preventing severe illness and hospitalization, as well as mortality for the individuals that receive them. What is also becoming clear, and I believe some of the delegates have alluded to this, is that it is not 100% at preventing infection. We are certainly seeing not uncommon breakthrough infections that occur, and that is the interesting combination and crux that now presents the challenge for us as a community going forward. Because the reality is that while vaccinated people are now at lesser risk of severe outcomes, of death and hospitalization, they may be passing it on to unvaccinated people in uncommon instances, and then those people may go on then to have severe outcomes. And at this point in time in the Region of Peel, where we have almost 400,000 of our eligible 12+ population that have yet to receive 2 doses of vaccine, that presents a significant risk for those individuals, and then collectively for us as a community, if all of those individuals at some point were exposed and were to fall ill. It's really important to highlight that while it's not about assuming that everyone has COVID-19, it is about assuming susceptibility and looking at susceptibility, particularly in respect to severe outcomes, such as hospitalization and mortality, that can essentially represent lives lost, represent overwhelming of the hospitals again, and again pushing us back into lockdown. And I think that really ties into the second thing I was going to highlight, is that vaccination certificates are meant to avoid that. The reason why we had closures and and curtailments in the first 3 waves was because we were a largely unvaccinated population. Everyone was susceptible to disease, and we had no way of knowing what proportion or who would eventually could potentially end up in hospital or worse. And I think that was the reason why we moved to closure and curtailment, because every potential interaction represented a potential point of risk of transmission. It's different now with the vaccines, as I've mentioned, and we know that with people having taken the vaccine and that reduced risk of severity, that individuals who are vaccinated are more likely to face a mild illness course in the event that they are exposed or infected. And so, to the extent that that's why it's important for us to really figure out, are we really going to continue to impose measures broadly across the community and shutter businesses and shutter gatherings again, or are we really going to try to figure out ways that we can protect those individuals who are not yet vaccinated to ensure that they are not necessarily in high-risk settings where measures such as masking or distancing, et cetera, cannot be consistently maintained? That's where something like a vaccine certificate in this time-limited period, while we get to the point where this disease is no longer novel, which is when everyone has been either vaccinated or infected, that's where this vaccine certificate is actually helpful in allowing us in certain high-risk settings that are non-essential. It's important to highlight that Ontario's program does not apply to basic necessities, but it is really about trying to ensure that we can avoid and forestall any broader lockdowns that would impact our businesses, our school community, et cetera, et cetera. So I think it's really vital to be clear about the science, and also in respect of how we track things. I think one of the delegates spoke to the adverse events monitoring system, VAERS, in the United States. VAERS is actually an incredibly sensitive system. Everyone reports any potential adverse event following a vaccination because we want to make sure if there is a signal, we're catching it. So there may be some very spurious associations that get put in there, and all of them haven't been assessed for causality, whether the vaccine was the cause. But it is this commitment to vaccine safety and this extent of monitoring that essentially allowed us to identify some very rare side effects with the vaccines, which were subsequently accounted for in the indications for use, and allowed us to continue moving forward with the confidence that these vaccines are safe and effective for our community. I unfortunately can't speak to the point of human rights, and at this point, Mr. Chair, before I begin my presentation, I will be led by you as to whether you want legal counsel to weigh in on that question.
If they would like to, a very good point, and thank you for your answer to date. Legal staff, with regards to the question of human rights, if you had a thought, I will take it at this time.
Yes, good morning, everybody, and thank you, Chair. I suppose what I might say to that is whether if the question is in regards to the vaccine passport system and the extent to which it may infringe on human rights, I think what I would say to that is that the system, of course, does not, as we understand it from the Ontario government information that's been presented so far, is that it, of course, does not mandate a vaccination, doesn't require individuals to be vaccinated. It does still permit a choice. There will be consequences for those who choose not to be vaccinated. However, the consequences are in respect of non-essential services, as Dr. Loh indicated. So it's not intended to be a system where an individual is not able to access medical care if they are unvaccinated or are unable to provide proof of vaccination, or to go into a grocery store and obtain groceries, that sort of thing. So it is targeted at non-essential services. So whether that in itself creates an infringement of human rights is something that I suppose courts could determine if the legislation is challenged. I might note, however, that the Charter of Rights actually does permit certain rights to be infringed. And it really is based on reasonable limits. The Charter of Rights allows governments to pass legislation which actually does infringe human rights to some extent, provided that they are reasonable in the circumstances. So they're subject to reasonable limits. The rights are not absolute, shall we say. So governments do have the ability to infringe to some extent, provided that they can demonstrate that the infringement is reasonable in the circumstances, and a global pandemic may well justify those limits. So there have been suggestions that the vaccine passport system may be challenged by certain groups. And if that's the case, these are the types of arguments that we would see, and those are the type of the issues that would be determined.
Okay, well done, Solicitor Kaza. Thank you. And Dr. Loh, thank you for that component of the presentation to very well address the issues that were raised by some of our delegates. With that, Dr. Loh, I turn to you for the body of the remainder of your presentation if you had anything further for Council. Please proceed.
So thank you, Mr. Chair, and thank you again, members of Regional Council. I also, again, just before moving on, wanted to thank again the delegates for bringing their perspective and understanding their input, and really urging them as well to continue asking their questions and perhaps to seek out advice and assistance from a primary care provider or from our vaccine clinic staff. I am very happy to present an update on COVID-19 here in the region of Peel as we return here in the fall. I'm also going to be touching on some information around our public health measures and also our planned next steps. So I think it comes as no surprise to Council, and it has been communicated previously just a few weeks ago that we are now in a fourth wave here in the region of Peel. We are in our 6th consecutive week of increasing transmission and test positivity. We are also seeing hospitalizations start to creep up in parallel to the rise in cases. And it's important to note at this point in time that almost all of the individuals that are being seen in hospital at this point in time are exclusively individuals who are not fully vaccinated. As social interactions increase, we're also seeing outbreaks that are linked to many of the social settings that we saw in the previous reopening in fall, usually linked around social gatherings, large social gatherings such as weddings, as well as nightclubs, sports tournaments, etc. So again, this really speaks to we are now a highly vaccinated community, but we are also a highly open community. And there's these two different trends that are essentially battling out in terms of transmission and severity that we're seeing both in the community in terms of transmission and severity that we're seeing within the healthcare system. With that, we're obviously monitoring the return to school very closely and will continue to take steps necessary to protect children, particularly as the community context will warrant. And in alluding to this, the fact that we're a highly vaccinated community, we have collaborated, through our collaboration with our hospital partners, primary care pharmacies, community agencies. As of September 3rd, we have now reached 84% of eligible Peel residents with a first dose and over 75%, which was that milestone that we were looking for, having received their second dose. But we do know that that previous milestone of 75% was made in the context of the Alpha variant. And as recently advised by the Ontario Science Table to help combat Delta, which is more infectious, we do know that vaccination needs to substantially accelerate above 85, possibly even to 90% of the eligible population. And especially as I mentioned, we still have, as of September 3rd, about 553,000 residents in Peel, 400,000 of which are eligible, and 153,000 who are not yet eligible based on age criteria. These residents are not fully vaccinated and do remain susceptible to COVID infection, and particularly for those residents out of that are older, to severity with infection, depending on the course of their illness. So in addition, and the Ontario Science Table has made it clear that in addition to trying to drive vaccination rates further up, we do also need to continue maintaining measures such as physical distancing, masking, avoiding large gatherings, and really trying to encourage reduction of contacts overall to ensure that through this turbulent period, while that large absolute number of residents remains susceptible and potentially could drive a fourth wave, a severe fourth wave, that we need to essentially do our part, getting vaccinated, reducing our contacts, and sticking to the precautions. On that count, we're doing our part in public health to implement some provincial measures that have been announced, as well as also taking measures locally. As was discussed with the delegates, the provincial vaccination proof of vaccination requirements will commence starting on September 22nd, and these are targeted specifically at high-risk indoor settings where precautions such as distancing, masking, etc., can't necessarily be fully maintained all the time. Again, because individuals who are unvaccinated and who may be exposed in such high-risk settings are at the highest risk of severe outcomes. That is the reason why this measure will hopefully help to reduce both the possibility of contact and infection, but also the possibility of severity for those who haven't yet had the opportunity to get vaccinated. Locally, we're also taking measures to protect the vulnerable, including timely and effective case and contact management, particularly with some of the large exposures that we are seeing. There is now an instruction and a requirement in our jurisdiction that requires event organizers and venues to provide us with a full list of attendees within 24 hours of a request in order to facilitate contact tracing. The size of these events has also necessitated that we move to an automatic public disclosure of any event attended by more than 100 people with 2 or more linked cases, just to ensure that we are getting information out to the public in a quick and timely manner who may have attended that event, so that they can take steps to protect themselves and their family. We've also implemented a number of recommended measures in Peel schools, which are available on our website, working with our school board partners at peelregion.ca/coronavirus/schools, which outlines all of the measures and recommendations that we have worked on with our school board. Many of them are similar to the previous school year and account for the Delta variant and the need for all of us as well in the broader community to reduce our contacts. We also have directed and recommended that workplaces consider immunization policies in their COVID-19 safety plans, while also maintaining critical measures around screening, masking, remote work, and sick leave. And we have also provided recommendations for municipalities as we move through what is hopefully the turbulent final part of the acute phase of the pandemic to extend local masking bylaws into spring 2022 to cover the fall and winter seasons. This will also help with other respiratory viruses, as we know, influenza and RSV and others that may be circulating in our community as we remain open. We are also strengthening our case and contact and outbreak management capacity to prevent spread early and also to manage more complex outbreaks because, again, similar to last fall, we are seeing a lot more contacts with each exposure, just given the size of gatherings that are now permitted. On vaccination, I wanted to highlight that our vaccination approach remains consistent with Ontario's last mile strategy. We have basically been pivoting to neighborhood level mobile and community clinics, particularly targeting neighborhoods with lower uptake to try to reach the unvaccinated. We've repurposed one of our dental vans to create a Peel Vax van. We also have a provincial Go Vax bus that we're working with. These are all vaccinating Peel together with numerous community and school-based clinics that are planned. And in September alone, we'll be operating almost 60 school-based clinics out of 17 schools strategically located in the community and selected in collaboration with the 4 public school boards in Peel. We will continue to expand community outreach and clinic offerings to reduce barriers and to reach those that are unvaccinated, as well as new population groups that are anticipated to become eligible for the vaccine. We are, of course, starting to ramp down our fixed clinic operations, but we do need to be ready for any additional vaccination requirements that go forward, such as potential broad population requirements for boosters of a 3rd dose, as well as vaccination of the 5 to 11 population. However, at this point in time, the Paramount and SaveMax clinic locations are anticipated to close by the end of September 2021, or rather to go on pause, I shouldn't say closed. And then there are 3 fixed clinics that will remain operational 5 days a week from the end of the month, and that will include our operations at 10 Peel Centre Drive, 7120 here Ontario Street, and Caledon East. And it's important to remember that walk-ins and appointments do remain available and open at all of our fixed community and mobile clinics, really encouraging everyone who hasn't had the chance to get their 2 doses of vaccine to come in to have their concerns and questions addressed, and then also to get their vaccine, should they feel comfortable. So I think collectively, obviously, we are heading into the fall and into the winter in 2022, and COVID-19 and mass vaccination remains a priority for public health, together with the rest of our partners across the regional corporation. We will continue to communicate to Council at the bi-weekly Council meetings through an update of this nature, with the weekly emails that includes updates and developments, and then we'll also continue to provide access to information through the region's COVID-19 dashboard and web pages, pages, as well as on social media platforms. This means that public health programs will largely remain paused until 2022, except for a few select critical public health programs that continue to operate at a reduced capacity to provide critical non-COVID but essential programs to our community. This will help to support the ongoing response for COVID as well as the vaccination plan. And we also continue to advocate to the province for effective provincial measures and policies that will help to limit the potential of the fourth wave, as well as sustain and reliable funding for our public health unit to continue to respond. So we will continue to monitor the situation, Mr. Chair and members of council. And with that, I thank you, and I'm happy to answer any questions you may have.
Excellent update, Dr. Loh. Thank you very much. I have questions. Councillor Sato.
Thank you, Mr. Chair, and thank you, Dr. Loh. You always give the facts, and I think that's important. So I have a couple of questions, but I had a couple of comments I wanted to make first, and then I'll ask my questions and be quiet then. I want to thank you for the announcement about the outbreak at Meadowvale 4 rinks, and knowing that it was a private tournament. I hope that none of my residents went to it, and I've had an update from staff on it as to our staff and testing and making sure that our staff are protected. So hopefully that won't extend much further, but I know my residents really appreciate it, knowing right away that it did occur in the community. I'm very concerned about the pressure that's on. I know it's not your responsibility, but the pressure that's on our healthcare staff in the hospitals, with the numbers going up and the numbers of unvaccinated that are crowding the hospitals. And maybe you could answer, if you know from the hospital information, are surgeries, essential surgeries, still being impacted because of the number of COVID patients that are coming back into the hospital? So that'll be one of my questions, and I'll go through them all. But it is a concern, and hearing the abuse that was on the hospital workers in British Columbia, that is absolutely disgusting. And I'll tell you, it certainly took away any sympathy I might have had for people that were claiming that they did not have to get, that their rights were being taken away because they were being asked to be vaccinated. That kind of behavior is just reprehensible. Can we get numbers when we have special clinics, like there was one held at John Fraser last weekend? And can we get updates after the clinics end, just a general idea on how many people went to the clinic, got vaccinated, and is that a good number or not? Maybe you could share that at some time. I just want to make a comment for communications that I was trying to post the John Fraser one again, and it was really easy from Twitter because I could pull up the region's Twitter announcement, and then I had the link for registering, but I couldn't find anything on the Facebook region page, and so I had to write my own and go back in and find the link myself. And I found that a few times that when things are tweeted by the region, they're not necessarily also put on the Facebook page, and that's where most of my residents get their information from me, is through Facebook, not through Twitter. So I'd ask if staff could take a look at that. So 2 other questions I have, sorry, if you could comment on the Mu variant. I was reading the CDC comments on it, that they don't see that it's a huge variant of concern yet, but they're watching. In a lab it is, but in real life and reality they're not sure, but maybe you could comment on that. And as we're going into the fall, we would normally get into flu vaccination season. So maybe you could comment on that one as well. Thank you, Dr. Loh.
Thank you, Councillor Sato.
You now to answer, Mr. Chair.
Thank you. Well put. Go ahead, Dr. Loh.
So through the chair to Councillor Sato, thank you so much for the questions, and I'm happy to help elaborate on some of the pieces here. In respect of the disclosure of events, I think I want to be very clear that our move to start disclosing gatherings over 100 is still in line with our usual disclosure policy. Again, we do disclose settings where outbreaks occur, where there's a risk to the community, or where we can't reach all contacts in a timely manner, and that's why we've been able to move forward on disclosing some of these gatherings where exposures have happened, including the one that you've described in your ward. I think in respect of our hospitals, as I understand it, we're not at the point that is currently being seen in other provinces, such as Alberta and BC, where they are starting to scale back surgeries and whatnot due to the significant surges being seen in those provinces. However, this really does speak to the need for all of us to try to encourage everyone to get double vaccinated, and also to support a slight reduction in our contacts and interactions. So we're not calling for stay at home and head back indoors kind of thing. Head back away from crowds kind of thing, but really just trying to limit, the size of gatherings, trying to ensure that you're still consistently masking in indoor spaces, avoiding really large crowds and all those other things to just try to keep the levels of transmission down while we race to vaccinate as many people that are still left to be vaccinated in the community. So I haven't heard anything yet from our hospital partners. I understand that a lot of them are actually trying to get through the backlog that has built up over the last few waves at this point in time, and we're not at a point like in some of the other provinces where we're seeing COVID force their hand in respect of their resourcing. I think in terms of the numbers seen at clinics, that's something I'm happy to take back and look at the team as to what we can do. We certainly, while we certainly would like to share successes with councillors around clinics, obviously, and obviously those numbers are often tracked just for evaluation purposes. We do also want to remember that our primary focus is getting needles into arms and holding the clinics. So I just have to see how that would work in terms of trying to get further numbers like to that level in terms of clinics and where they're happening. But I can commit. I'll undertake to take that back to the team and to look at that and see if there's ways for us to share information as we can. I am unfortunately unable to speak to the communications piece, but I'll defer to my enterprise services colleague perhaps to speak to that. I will speak though on the last two things, which is really around the Mu variant and the flu vaccines. So the province is, as I understand it, starting with the last first, the province is in the process of putting together the universal influenza immunization program details this year in terms of the vaccines and the formulations that will be used and all those other pieces. So I'm anticipating that information will come sometime this month, hopefully for a launch again as we did last year in October or November. In respect of the Mu variant, I would agree with, I believe, what Dr. Anthony Fauci has said publicly that Mu is something that we're certainly keeping an eye on, but the reality is that we're seeing significant transmission that's currently being driven by Delta, which is a significant variant in its own right. So while Mu may be something to keep our eyes on at this point in time, we're really focused on dealing with the Delta variant.
Thank you. And for that last communications piece, if Keith or someone could give us a response to that.
Actually, Mr. Chair, I could probably speak to that.
Certainly, Gary, please.
Through you to Councillor Sato. Yeah, we'll look at that. It's a good reminder to us that all our channels should reflect the material messages. So on occasion, something might slip through, but we'll go back and make sure that that's in place. Thank you.
Commissioner, thank you. Okay, moving on with my questioners. Councillor Parrish.
Thank you, Dr. Loh. Nice to hear you and see you again. Couple questions. Have we had an increase in people seeking inoculation since the passport was announced?
So through the chair to Councillor Parrish, yes, we did see a brief bump and then a bit of a tailing off over Labor Day, but we obviously continue to monitor the numbers. I think immediately after the announcement came in, though, we moved up to almost 75% capacity, including 90% at our fixed clinics. So that was a good bump for some days, and we'll obviously continue to monitor demand.
And are we getting a good response with the Vax vans at Westdale Mall? I know you just said you're not keeping a close track of it, but I think you can feel it there if there's an increase.
Yeah, so through the chair to Councillor Parrish, my understanding is the Vax vans have been highly successful, and the best part about them being successful is that while the inoculations tend to be smaller, like you're looking at dozens and dozens, but they all tend to be first doses, which is really the big thing. We're just trying to get people that initial protection and on their journey to full protection with 2 doses.
And would you, I remember I talked about Vax vans going into places of employment, large factories, places where there are a lot of employees. Is that still on the table? Is that a possibility?
Yeah, so through the chair to Councillor Parrish, we are obviously regularly reviewing the data as to where we're seeing high and low rates of vaccination. Certainly, we had a very successful workplace clinic system that rolled out through the first 2 dose the first 2 dose campaigns in the spring. And we'll obviously continue to work closely with area partners. So, right now the focus is really on the school hubs throughout the month of September. We have 57 dates confirmed in September and October. And of course, we'll continue to identify other areas. And as I understand it, we are, employers are certainly one group that we're continuing to work with throughout this last mile strategy.
And I know it would be a logistical headache, but is there anything in place to follow up with people that got the first shot and then disappeared? You have a record that they have the first shot.
So through the chair to Councillor Parrish, my understanding is that the provincial booking system center has actually been helping to call people back who've not had their second shot within a certain time frame, and I anticipate that work will continue.
Good, thank you. And my last is just a comment. I've noticed, including my own local family practice clinic, we're getting just phone responses from doctors. They're all very reluctant to see people face to face. Big signs on the practice saying new patients welcome, which is nice for a change because you can't get a family doctor. But my concern is there's going to be a lot of serious problems hit the medical system after this is over, because I think when you have a face-to-face with a doctor, they can find more things, they can do a checkup. And I'm just not thrilled about the fact that I think you're going to see a massive wave of serious problems when this is over. So maybe doctors' practices should be encouraged to start opening their doors a little bit more. I know dentists and oral surgeons who are not on OHIP have all been open through this whole thing. Mm-hmm. So, I think there's a serious difficulty that is on the horizon for us, and I guess we have to be ready for that. But thank you very much. Thank you for everything you're doing.
Thank you, Councillor Parrish. Councillor Paleshi.
Thank you, Mr. Chair. Thank you, Dr. Loh. Nice to see you. Dr. Loh, briefly, and I'll try and be quick. Rapid testing is becoming more available in a lot of the pharmacies, and at the City of Brampton, we're providing rapid testing for businesses. Can you comment on the rapid test, how you feel about them, and also as I still firmly believe that testing is one of the most important things that we can do. Is there an opportunity for us at the region to try and make them a little bit more available for people? Have we looked at anything like that?
Yeah, so through the chair to Councillor Paleshi, on the second point, I mean, I know that the province does have a significant number of, I believe they still have a significant number of rapid tests that they are making available to workplaces and so on. And of course, there are the broader tests that you've identified are in the private sector. So I think that the availability of tests is there. It's not something that I've necessarily heard a significant concern about. I think the broader piece in terms of the use of rapid tests, these are typically more used not for individuals who are symptomatic, but individuals who are asymptomatic. And in the event that there is, someone who does test positive, you really do still need to confirm it with a PCR test just to be certain. So I think it may have its certain uses, but I think its overall usefulness is quite limited by the fact that it does require that confirmatory test, and it has to be used just under specifically in individuals that are not expressly showing symptoms at the time that they're tested.
But if there are people that are showing symptoms and they get a rapid test and it's negative, they should be comfortable not to have to get the next test, right?
So So through the chair to Councillor Pleshy, this is actually an active topic of discussion at the provincial tables. And I know that Public Health Ontario has been looking at data that's trying to validate rapid tests against PCRs. Right now, the testing guidance hasn't changed in respect of symptomatic individuals. So a symptomatic individual should still seek a PCR test. And then if they've unwittingly or otherwise taken a rapid test, even a negative test, they would still be recommended, if they're symptomatic, to actually get a PCR done.
Okay. And then my last question is just with respect to, I guess, if, fast forward 5 years, 10 years from now, if we're going through something similar, and looking at maybe potentially this year's budget and questionnaires that have gone out or could go out to all of the tremendous workers that have been out there on the front lines. Is there anything that you're looking at to come to Regional Council for this year's budget to start implementing? Are we looking at opportunities where we can find efficiencies, whether it be operational efficiencies, if we're to fall into something like this in the future?
So through the chair to Councillor Pleshy, I think that's probably a question better answered by finance, at least in terms of sort of the future casting and what things are going to look there. But in terms of our own budgeting here in health services, and I would also defer to the Commissioner of Health Service to speak to this. We're only really just starting out some conversations and identifying various aspects for budget planning, even just for 2022. So it's a little difficult for me to sort of forecast what it would look like 5 years in the future. But I don't know, Commissioner Polsinelli, if you wanted to weigh in on that front in respect of budget.
I guess just before Commissioner weighs in, and I guess my question more to you, Dr. Loh, is any recommendations that are coming out of your office that you see that we weren't best set up to handle something? I guess that's kind of where I'm going with.
Sure. So actually, I can answer that. So through the chair to Councillor Pleshy, we've actually retained the services of a consultant who's actually helping us to identify, at least right now in this hot wash, like some lessons learned from the emergency response, et cetera. And I know that there are some council reports that are anticipated for later on this fall and early 2022 that will speak to some of those lessons learned and perhaps bring some of the recommendations you may be looking for at that point.
Thanks, Dr. Loh. Mr. Chair, if the Commissioner can just weigh in.
Yeah, if either Nancy or Gary or both regarding what do we see in the future, some of the financial implications of the fallout from COVID will be in the years to come. Perhaps Gary first and then Nancy, Commissioner.
Sure, I can start, and I'll keep it simple. I think Dr. Loh, gave the overview. I think we're caught in purgatory just now. That's the conversation. We don't know if this is an emergency or a program. So we're not set up to run this on an ongoing basis. So at the beginning of budget discussions this year, we will give Council a full update on our financial picture. We're really going to take a same approach as previous years, that have a normal budget, and there's going to be exceptions. And what's our financial strategy to meet those exceptions? Commissioner Polsinelli and Dr. Loh have mapped out what they think the next 6 months are going to look like from a program point of view, if I can call it that. So that's been very helpful to us, and we're currently costing that out. I'll leave my comments there and maybe ask Nancy if she wants to add to those.
Please, Commissioner Polsinelli.
Thank you. And I think both Dr. Loh and Commissioner Kent answered it very well. At this point, as we work actively on still COVID response and vaccination, there is a team that is also actively looking at future planning, whether it be a program that includes vaccination for a longer period of time, and also the needs of the public health division, starting back up a lot of those essential programs that have been paused or slowed down. And in that work, as Dr. Loh said, we are working with an expert, a consultant who is supporting those conversations. So you may not, outside of COVID funding, you may not see a lot come out of public health for the 2022 budget at this point, but certainly for 2023, we will have more information. We'll know more. We'll be in a different place, I'm hoping, so that we can continue this conversation.
Thank you, Commissioner. Has there been an opportunity for us to reach out to any of our frontline staff to have them provide comments, negative and positive, so that we can learn from and do better?
Sorry, I saw Dr. Lowe's head nod. I didn't know if you were going to answer, Dr. Lowe, but absolutely. So to answer your question, that we have been since the start actively working with our staff. We have a small group within public health and the health department linked to HR that speaks to the psychological health and wellness of our staff during the COVID response. And through that, there are many opportunities, many touch points, many focus groups, so that we hear their voices as we build on that future planning. Certainly, as we hear their voices as we continue to improve, even how we do vaccinations and how we work with them. So absolutely, that has been a priority for us, our staff.
Thank you, Commissioner. Thank you, Gary. Thank you, Doctor. Back to you, Mr. Chair.
I think the CAO, Janice, might have a thought on the conversation as well. CAO Baker?
Good morning and thank you. Yeah, it's a great conversation to have. I think the one thing that I would add to what all of the team have shared is the level of disruption that we're seeing right across the entire regional portfolio. And you've heard me talk about this before, but I think this also needs to be said. So to the degree that we have a large number of staff who are redeployed into the COVID response, whether now primarily supporting mass vaccination, but also the earlier response programs. We are really challenged, and Lawrence and Nancy have done a great job, as Gary mentioned, of mapping out for us how we see the short and medium term for this program. But we have a series of leaders and others who've been redeployed. We are really struggling to hire for those positions. So again, the conversation, and Gary alluded to it, is this now an emergency or is it a program, is something that we're assessing, but we are still running it as an emergency. We are still really using resources that have other full-time jobs to support this program. So, for example, at the end of August, we met as an executive leadership team to look at our corporate priorities. We have a number of internal initiatives that under normal circumstances would be rolling full steam ahead right now that we still have on pause because key people who would normally be leading and rolling those out are otherwise engaged to support the COVID response. So unwinding this and adjusting this will take time. It is something that is still very much a work in process. We have great minds working on it and thinking about it and trying to make the adjustments. But, in short order, we're going to be 2 years into a program that has really affected not just health, but has affected the entire corporation in terms of the way that we have needed to come together to support this program. So, you're going to continue, I think, to hear that, but it's another important point that we need to make. It's not just centered in health and the impacts on health. This is a corporate-wide disruption that we're trying to manage. So I just wanted to put that on the table as well.
And well put. Thank you. Very good discussion. Thank you to all. I only need receipt, so if Councillor Palleschi and Sato would move receipt of the presentation. Is anyone opposed? If not, that carries. Thank you very much for the update, Dr. Lowe and all. That brings us to our final staff presentation, 9.1, Integrity Commissioner's Periodic Report, Region of Peel. Here for information, a presentation from Jeffrey Abrams and Janet Atwood-Petkowski, co-principals of Principals Integrity. excellent report accompanies the presentation. I think we've all read it, and just marvelous in terms of how it deals with the past year and how everything's been dealt with. And just in advance, to let my colleagues know, after discussion with the clerk and I, we thought that 10 minutes might be appropriate for this as opposed to the usual 5, because there's a lot of supporting conversation perhaps related to the report, after which we'll go into questions. So over to Jeffrey and Janice.
Good morning, Mr. Chairman. Can you hear me?
Yes, I can. Please proceed.
Thank you very much for allowing us to appear before you this morning. Somewhere on the screen, you may see Jeff Abrams as well. I will be doing a brief presentation of this, and we look at this as a good news story. This is really a periodic report. In some municipalities, we have brought reports every couple of years, but we've had quite a bit of engagement with the region of Peel and haven't felt the need to bring annual or semi-annual reports. But this is a periodic report sort of looking back, and we like the trend that we see, and we want to just not take up too much time in your agenda because you have a busy agenda, but wanted to highlight some of the things that you have done as a council, some of the things we have done for you in our tenure, and looking around the province from our vantage point to just look at some of the other things going on. So briefly, I won't drag you tooth and nail through the whole report. As you say, Mr. Chairman, most people have probably read it. Certainly, we categorize the services that we provide for you into really 3 buckets. And the first is to do with assisting in the development of policy and supporting education of members on their ethical obligations, including conflict of interest and code of conduct. And you will see that we reflect on the hard work that the Policy and Procedures Review Committee did with our support in terms of redeveloping and revising a new code of conduct for council, which really we think reflects best practice. And that was adopted, it's just about a year ago now. It was before council, and that there was a lot of heavy lifting done in that, as well as reflecting into that some of the experiences that we had experienced and you had experienced. Understanding how an upper tier integrity commissioner and a lower tier integrity commissioner kind of make sure that their work doesn't trip over the other and dovetails where it needs to, and that type of thing. And that is now written into your code of conduct in a very helpful way. The second bucket we look at has to do with advice. Now, members of council and members of local boards are at liberty to reach out to their integrity commissioner to seek a confidential advice, and we call it binding advice, from the integrity commissioner as to how to proceed when they're faced with maybe gray areas or issues of that they think may be tripping over a rule or a provision. And so they could seek out some ethical guidance from us. We provide that to them in a brief advice memo, which outlines the facts and points to why we've arrived at a position we have, and provides them with binding advice so that if there is a complaint after the fact, so long as they've followed the advice given, they're bulletproof so far as we are concerned. And so while we can't explain or go into detail on what advice we've given, suffice to say, the advice that we provided, we had 5 requests for advice over the period of this report. We recognize that although that may not seem like a lot, members of council are supported by their local integrity commissioner at the lower tier. And therefore, we're only seeing a small area where councillors may believe that there's an issue at the regional level. So we recognize it's in those 5 instances, we provided the advice, we explained the advice, and the members were satisfied with the advice. In terms of the third bucket, that is really the mechanism for receipt of complaints. And so we have outlined just briefly at a high level a couple of areas that we thought were of interest to Regional Council in this summary report. So we have, over the course of this period, received 12 complaints, which we've looked at. There is a typo that says, it's my fault, my mea culpa. It says all but 2 were resolved without a public recommendation report. That's actually all but 3. We have had 3 opportunities where we've reported back following a full investigation. Now, we have a triage process and we have a review process where we determine whether or not the matter is within jurisdiction, whether it warrants in the public interest an investigation. And many complaints fall out and are disposed of without full investigation. We think this is the best practice for integrity commissioners in exercising their discretion, and that's why we do this. Where we are able to resolve a matter without a formal investigation, where we find that a complaint is either out of jurisdiction or doesn't, for whatever reason, warrant not prima facie contravention on the face of it, or does not warrant a full investigation in the public interest, we do a full disposition back to the complainant because they can always pursue a complaint to the provincial ombudsman should they wish, and that creates a starting point. And where the member has been involved at that preliminary stage, we provide the member, the respondent, about whom the complaint is brought, with a copy of that disposition so that they understand why we have concluded that there is nothing to pursue in terms of a public report. And so we are not at liberty to speak about all of those matters that were disposed of without a recommendation report, but we just highlight a couple of areas in the report. And one is where we determined that the referral of a lower tier integrity commissioner's report was not a sufficient basis to trigger a recommendation from the regional integrity commissioner on additional sanctions. In that case, we took the opportunity and working with the Policies and Procedures Review Committee to embed in the Regional Code of Conduct some guidance on treatment to be given when an alleged conduct touches on a member's role at both the lower tier and the regional level. And so that is embedded in your Code of Conduct, and we think that's the appropriate place, and that is what Council adopted. In another instance, we found that complaints against members of Council alleging breaches of health protocols in effect under the Emergency Management and Civil Protection Act for participation in parades to support frontline workers, while constituting a technical breach of a provincial regulation, we found that given that the province had clearly deferred enforcement to the local level and to the local police that was organizing the parades, it would not be in the public interest to sustain a complaint under the Code of Conduct. And again, that matter was formally disposed of through a written disposition. Just in terms of we have reported once earlier this year publicly regarding an investigation and a complaint. Generally, we like the trend we're seeing. Generally, we see sophisticated and knowledgeable elected officials around Council who understand very well their ethical responsibilities, and where there are gaps, we hear from councillors seeking advice, and we certainly appreciate that for Regional Council. We serve in this capacity for over 40 municipalities and a large school board, and so we have a bit of a vantage point to see that. Without, again, dragging you tooth and nail through everything that we see happening around the province, I will just touch on one of the points in the report, and that is the provincial consultation. And so the provincial consultation was conducted, it was launched in March, and it was conducted through the early and mid-summer. And we, Jeff and I, led a group of our fellow integrity commissioners at the MECO, Municipal Integrity Commissioners of Ontario organization, to develop a submission. And so all of those papers from the Ombudsman, from AMO, from MECO and other groups have now been landed at the ministry, and we will all wait to see what will arise from that. But certainly some of the things that are spoken of are that integrity commissioners, one of the questions was, should integrity commissioners have greater authority to impose greater sanctions? And certainly we can just share with you that is not generally the view of MECO, that there should not be greater ability to impose greater sanctions on elected officials by integrity commissioners. We think that generally the scheme works fairly well, and we think that although there should be perhaps some tweaks, on the whole, we think it's working fairly effectively. And certainly what we see at the Region of Peel is a very effective mechanism and a very robust code of conduct, which you now have in place. So subject to any questions you may have, those are our comments.
Thank you. I know it's here for information. I don't see any questions. Perhaps I can say the word that sums it up for me. In reading the report, I took comfort in it. I hope that sort of synthesizes. Just it was well explained, your role, what our roles are, and this is why we're here. And sometimes we need guidance and an understanding moving forward. And I thought the report explained it very well. And I'm glad in how you articulate it. We have some comfort going forward. Councillor Dasco.
Thank you through the chair, and appreciate and thank you for the presentation, Janice. Question I do have is just with regards to the social media component. Is this something, and just because social media seems to keep evolving by the day, and depending on what platform you're on, if it's Twitter versus a Facebook versus Instagram, etc. And I'm just wondering, is this kind of best practices, and is what is being adopted through is it MECO that you had mentioned?
Thank you for the question, and through the chair. So the commentary that we're providing, and while it's not attached to the report, it is the clerk has it, and we can certainly provide another copy if need be. It really provides just additional commentary about members, a caution to members about blocking, arbitrarily blocking others on their social media, where the social media is in fact being conducted as a sort of a town square forum on issues that fall within the purview of regional government. So it's just a bit of a caution. It is not adopted at this point by MECO. I'm racking my brains as to whether it's actually been presented and discussed at MECO. It's been an odd couple of years for MECO. We only meet by Zoom, and so I don't believe that we've actually talked through this with MECO, but it is, this position is evolving through the reporting of other integrity commissioners. So there's a kind of a coming together of a thought on this from a number of different integrity commissioners and other jurisdictions, where if the elected official is really engaging in a whole political town square kind of dialogue on social media, it's not appropriate to arbitrarily block somebody simply because they don't agree. And it's kind of underscores the democratic principles. So it's not complicated. But what complicates it is the fact that social media is evolving so quickly, and so few municipalities have robust policies dealing with communicating using social media. And there's other pieces of general social media policies that most municipalities want to pull into such a policy. So we thought this is a little bit of, sort of 2-paragraph long commentary just to plant in the actual code of conduct under Rule 10, media communication, really just as a heads up, so that it's arisen a number of times in our work over the past few years, really 3-4 years. And counselors are sometimes surprised that, oh, it's mine, I can't just block them. Well, if you're having that whole political discussion on a social media forum where it's really the elected official engaging with constituents, it's not right to be just arbitrarily blocking. It's okay to say, stop being offensive, or I will block you, or stop doing such and such, or I will block you, that type of thing. There's blocking, there's muting, there's a whole bunch of layers of things that go on.
Yeah, and this is kind of where I'm going with this, Janice, is just because it is evolving so quickly, and not all. I would imagine a fair bit of councillors around this table and other municipalities. There's posts that go out, and there's certain platforms where it's not to get into a healthy dialogue and debate. Sometimes it can be outright offensive in some cases, and so I've yet to block anybody on any platform that I do have, but that's the concern I have, is anytime somebody might do that all of a sudden it's going right back to the integrity commissioner, and it creates a whole other level of bureaucracy, and so I just have some concerns in terms of how that might look, and so that's just one, because again, to your point, it's evolving so quickly in terms of a medium and how folks tend to get messages out.
Yeah.
If I could I just respond to that, Chair, because that's an excellent point. And certainly one of the first things we do on such matters is go back to the complainant and say, well, listen, have you asked why you're being blocked? Have you asked to be unblocked? What else has gone on here, before we would have even reached to the counselor? And then we would, if they've said, where they've said, I have no idea and I haven't done anything and I've just pushed off that because of a political opinion, then we would proceed to be asking the counselor. But definitely we try as much as possible to not become sort of a bureaucratic process, but rather to push it back and say to a complainant, have you asked? Can you, if you've asked Councillor so-and-so to unblock you, is that not working? That type of a thing.
Okay, thank you very much. Thanks for the presentation again.
Thank you. Councillor Sato.
Thank you, Mr. Chair. And following up on Councillor Daskell, our governance committee at the city and council agreed that we are not putting this in our code of conduct. We had quite a lengthy discussion about it, and I think actually it was Councillor Raz who moved the motion that we just accept it as not as policy, but I think it was as information. I can't remember her exact wording. She might, but I would not want to see it in the code of conduct at the region either. I think it is. It puts members of council in a very difficult position. And if we are not able to manage our social media accounts individually and deal with people who yes, maybe getting into areas that we don't agree with, but areas where they are becoming insulting, where the conversation, especially on Facebook, becomes inflammatory, where people start talking back to each other in a way that I may not feel is appropriate and was never intended by the original post. And I will remove people's posts. I may not block them, but I will delete their comments. And I have told residents that if I feel that, for example, if they're going on and on and on about our health restrictions here at the Region of Peel as it relates to COVID, I will not allow that, because it is totally contrary to our policies here and to what we are trying to achieve. So I think we need to have the flexibility that we can manage our own accounts. And I'm responsible for what I say on Facebook. The city is not, the region is not. I'm responsible for it to the taxpayers who have elected me. And, you know, there are things that I won't allow. And, you know, if it comes down to the point where we are so restricted in what we put on social media, and I disagree that it's a town hall. I don't agree with that, because at a town hall, I would speak out and I would tell people exactly the same thing. And I would have their microphone turned off and do all kinds of things like that if they started saying publicly out in public what they would be saying on social media. And usually on social media, they can hide behind the screen. So, you know, I think we get a lot more inflammatory. I don't use Twitter for many conversations. I'll post things on Twitter, and every now and then I will make a statement, but I use Facebook more for conversations with my residents. And I don't want to be restricted on that. And I don't think we should be. I think we are all responsible for it. So I would urge regional council, and I guess that this will be discussed anyway at the Procedures and Policies Committee, but I would definitely urge council to really take a good look at this. And we had a good discussion about it at the city, because Janice had indicated to me, because I had blocked someone on Twitter and he complained about it. And I've only ever blocked 2 people. And I did put him back on, but I just don't read his posts anymore. So it really doesn't matter that I haven't blocked him, because I don't follow him. You know, if he wants to read mine, if he responds, I don't respond back to him. So, you know, it's kind of the same thing as blocking. He's speaking to dead air. Anyway, I just want to warn council that you need to be very careful about what you put in the code of conduct, because it could really put us in a position where people are able to post things on our social media that are totally inappropriate. May not go beyond the point where blocking is considered legal or allowed, but is still bad enough that we don't want to see it on our accounts. Thank you.
Councillor Sato, thank you. I think we're getting into a discussion of what might be, and if it might be, it will go to committee. And so good points to make. It may be back on our agenda again, but if there are more specific questions, I have Councillor Parrish.
I don't have any specific questions. It's a good report, and I thank the integrity commissioners. I agree with Councillor Sato, though. What happens when you get incorrect factual information being thrown about by constituents, it tends to get more veracity as it gets repeated and responded to. So I probably in all my years blocked 3 people, but they're obnoxious, difficult people, but they also lie on Twitter and they put out false facts. So I'm glad we didn't agree with this at our city, and if it goes back to our committee here at the region, I won't be supporting it, but the rest of the report was good. Thank you.
Thank you. Councillor Parrish, thank you. That's my list here for information, moved by Councillor Daskal and Councillor Sato for receipt of the information. Anybody opposed? Seeing none, thank you very much to our integrity commissioners. Okay, moving right along, I think that brings me down to items that were held on consent. 14.1, held by Councillor Groves. Noise wall petition for DeRose Avenue, Town of Caledon. Councillor Groves.
Thank you, Chair Ainika. Just a quick question on this. I don't have any comments on the report, but I did have a meeting with staff yesterday, and together we drafted that motion. So do I bring this, just a matter of procedure, do I bring this motion forward now or at a later time on the agenda?
Madam Clerk, I would think it'd be appropriate. It's the matter before me now. If you have a motion, I would welcome a motion that's been moved and seconded.
Yes, that is correct, Chair Yanika. This is the appropriate time, and the motion itself was emailed to all members of council this morning around 9 o'clock.
Okay, so everybody has the motion before them. If you would like to speak to your motion, Councillor Groves.
Thank you, Chair. And just first off, I just want to thank staff for, excuse me, working with me on drafting this motion. We did vet it through the different departments. And I think our staff in the on the public works side as well as the finance side, we're fine with the motion. So I just want to thank staff for all their work in helping me to draft this motion. I think it's fairly reasonable. It's a reasonable ask, and I think my residents will be fine with the way the motion is drafted, that we do look at this in the 2023 budget. So thank you, Mr. Chair, and thank you to staff.
Very good. Carrying on with speakers to the motion, I have Councillor Sato and Raz. Councillor Sato.
Thank you, Mr. Chair. Could I get staff to comment before supporting a motion to add a noise wall that is considered to be good? Because I know I have some that my residents have asked to be replaced, and we've told them no. So I'm a little reluctant to add one without a staff report on the actual condition of the noise wall, except for the fact that they looked at it and said that it was in good condition. And, you know, is staff, and I'd love to support you on it, Councillor Groves, because, but I'd love to have, I think I have 5 others that I could add to the 2023 budget as well. I'm sure other members of council do too. So I would like to hear from staff or see something from staff that would justify a good noise wall being added to, I know it's a future budget, but it is only 2 years away. And how is that going to impact, and what other good noise walls are we going to add to that? And, you know, as I said, quite frankly, if we do move ahead, then I'm going to bring a similar motion before the end of this year.
Fair question. Commissioner Dedman is prepared to answer. Commissioner Dedman.
Thank you.
Yes, thanks very much for the question. Although staff did assist the councillor with the motion, it's still staff's recommendation that we proceed with the existing plan that is approved by council, whereby we replace the noise walls or convert them based on condition. That's for a number of reasons. It protects the residents in terms of health and safety, but it also most efficiently is the use of tax dollars, because we're replacing those noise walls as they reach the end of their life and not beforehand. In this case, the staff report on this agenda notes that the wall is in good condition, and as a result of that, it's not currently within our 10-year forecast.
Could I ask also, were noise levels taken, and do they meet our current requirements? I know residents will say the noise is too much, because we all hear that all the time. But do they meet the existing requirements for noise mitigation?
Through the chair, staff have not taken noise reading or noise level readings at this location because it's not within the 10-year forecast, and also because that's not one of the conditions of replacement that's part of the policy.
Okay, Councillor Groves, I'd love to be able to support you on this, but I'm afraid I can't. It's just kind of jumping something in that is not required, and noise walls are expensive. Do we have a cost that what this would be, Keely, based on the length?
I do not have a cost on this particular length of wall. At this point in time, the region invests $3 million a year in the replacement of the noise walls that are in the worst condition, that have been prioritized. And at this point in time, we are just staying ahead of those that are seriously deteriorating. So our resources are being well used, and I've just received a note from staff that in fact this noise wall would be approximately $500,000.
Okay, so that would either defer something else or it would add to the budget for that particular year. And if it's not required, just because it's wanted, I think I think when we look at our budgets, we need to be very careful for things like that. And I know I've told residents no many times because of the same reason. So I'm sorry, I just can't support this one popping up and jumping in.
Thank you. My list is Councillors Raz, Demerla Innes, and then I will ask Councillor Groves to speak last to her motion. Councillor Raz.
Thank you very much, Mr. Chair, and thank you for the staff report and for the motion. I guess I have similar concerns along the lines of Councillor Sato. Peel Regional staff are working on a noise wall in my ward. It's taken years to get to that point. There was no condition because the wall in many places had completely collapsed. We've been working through the process, and I've been waiting on this for like 6 years. So there is a process in place. The fact that it was assessed in good condition, if there's repairs that can be done for maybe spots that can have a temporary repair, that maybe that's something we can look at. But before this motion is so definitive that said it does get added to the 2023 capital budget, well, why maybe to placate everybody, we can look at for consideration for the 2023 capital budget. And let's look at all of those other projects that are in poor condition that need replacing first. We only have a set budget, and a $500,000 project is not chump change. So I would like to take a better look at what's on the table in terms of the noise walls that need to be repaired or converted to noise walls. You know what? Noise, I think we can all attest, has been an awful, awful issue during COVID, especially with the loud noise-making vehicles and trucks. It just seems to be getting worse and worse. So I think everybody's very sensitized to that, and I certainly appreciate it because I have major arterials in my ward. So I can't support the motion as written, and I would like to see more information, but I would happy to support it if it said for consideration, because we do need to consider it in light of everything else. And I don't want anybody else's noise walls that are in poor condition to get bumped for something that's in good condition. So thank you very much, Mr. Chair.
Thank you, Councillor Demirla.
Thank you, Chair. And, I and Chair Unica, you may be aware of this, but there's a number of residents along Queensway that have been asking for a noise wall for years. And I know you turned them down. And unfortunately, I had to turn them down last week because part of it is I understand that it's a 50-50 cost sharing. So I'm kind of curious, we need some clarification on this particular Rose Avenue. Would it be 50-50 cost sharing, or is the region paying the full price?
Through to staff. Can staff answer that?
Sorry, I will have an answer back to you shortly on that.
Well, to me, that would be important before I could even begin to support this. I've had to say no to my residents because the region of Peel said that although Queensway is a very good candidate for a noise wall, given the amount of traffic, that each resident would have to pay, I think, something like $7,500 to $10,000 per home that would go on their property tax. And I was also told that this is a province-wide requirement. It's not a region of Peel rule, that's how it. So I'm kind of curious as to how Rose Avenue, which in my opinion is very similar to the Queensway situation, where public dollars are being now spent to create a public noise wall. One, why that would get fast-tracked, because there's an existing noise wall while Queensway doesn't have anything. So, and second, if this is going to be paid 100%, while there are other streets, and I don't know what Councillor Raz's situation is, whether it's 100% or 50-50 cost sharing, but there just seems to be some anomalies that I'm not fully aware of, but I want to make sure that all wards across the region of Peel are treated the same. And if there's going to be a prioritization of one particular street, that all are considered, that we also consider streets that desperately need the noise wall, where the region has said, yes, noise is an issue, but then we've said, oh, the residents have to pay for it. In that situation, it becomes hard for me then to support an existing noise wall while I've said no. So I'm not able to support this, even with the word consideration, because it sort of still puts this ahead of another need. So either we do a comprehensive survey of all of the outstanding asks that are legitimate, where the region has said, yes, there is a noise issue and deserves a noise wall, and then come up with a comprehensive solution that is fair to all, including the cost sharing. So at this point, while I'd love to support it, I'd love to be able to put in Queensway next to DeRose noise, but I'm not going to be doing that. I'd rather maybe staff can come to us with a report on this whole situation, including the 50-50 cost sharing, and is that across the board or is that just in certain cases? And so maybe if I can ask Councillor Groves that perhaps we wait till staff comes back with the report, and then maybe then we can all craft a resolution that might help more residents. Thank you.
And I'll ask Councillor Groves to speak to that after the next two speakers, so that again she can bring the matter home as she sees fit. My last two speakers are Innes and Paris. Councillor Innes.
Thank you, Chair. And thank you to staff for the report. I know that the private noise wall conversion program has been a difficult and contentious one, and I know we've been dealing with ones in my own ward, which is adjacent to this, along Airport Road as an example, and getting sort of convoluted in the Airport Road EA project. So there's lots of moving parts with this conversion program. I guess part of my concern is to hear that noise isn't an issue. So when we make these noise walls mandatory as part of the construction of either the improvements to arterial roads under our jurisdiction or to the building and new development of subdivisions, we set them to a standard to minimize the impact of the noise. That's why they're called noise walls, to minimize the impact of vibration from the traffic and the truck, which is being felt by these homes from the Emilcold Parkway. So I guess I'd like maybe staff to sort of take that back when it sounds to me like there's going to be a review come forward of this conversion program and the status of all of the noise walls that will be converted and what the priorities, the determinations will be to either convert or repair, because these residents, their noise wall was built long before that Emilcold Parkway came into existence. And I'm sure that when the study is done to measure the noise levels, it will not be sufficient, because it wasn't built knowing that route was coming. It was built before that was even in the works of coming. So, those residents, like, residents along the Queensway, are hearing and feeling the noise and the vibration because, while they have a wall, it's not adequate. And when we built that Emilcold Parkway, we probably should have looked at doing a conversion to that noise wall at that same time. And maybe that's something that we should be putting in as a necessary step when we're doing future projects, that if there are noise walls and they're part of that conversion project and they do become public ownership, that we should be budgeting to convert those noise walls to be adequate for those residents, so that we don't run into this again. Because I do feel for the residents, I feel for everybody that are now dealing with the noise, because they don't have adequate coverage. So I support whatever direction we take. I support the motion as is, or if Councillor Groves feel comfortable putting it in and asking for a complete review and a discussion of the standards, and a discussion ensuring that those policies are put in place to make sure that we're not in this situation again. Thank you.
I'm going to go to Councillor Parrish, then Keeley, the commissioner, may have an update, and then Councillor Groves. Councillor Parrish.
Well, I would favor deferring this decision because it doesn't sound like it's terribly popular right now. I find the petition, the whatever the heck the company is that does it, where you get names from all, or change.org, very misleading, because you've got quite a few names on there, but there's actually 13 residents involved. I found it a little disconcerting when the staff said it was in good condition overall. And you lived through, Nando, our debates at Mississauga, where it used to be you had to get 75% of the people on the street agree to replace the wall, and then you had to get them to pay for half. We changed it so that it's fully paid for by the city now, but the city prioritizes the walls that need doing in an order, like we fix sidewalks. There's a whole system to it. I don't know if Keeley's got the answer yet as to whether the residents have to pay half, because I don't remember if the region went along with us or if theirs was a separate situation. So It's $500,000 for 300 locations. That's $40,000 per household, depending on, I guess, the length of their backyards. But I think it would be much better to have this come back with some photographs and some discussion on the condition of the wall. I'm not comfortable casting two votes either way for this. I'm just not quite, I don't have enough information. So I would appreciate it if Councillor Groves would defer it and bring back more information and some photographs and a study on the walls themselves and know if the residents are paying half or if they're not.
Commissioner Dedman, thank you, Carolyn. Commissioner Dedman, did you have an update for us?
I do. Thank you, Mr. Chair. And to the earlier questions regarding the cost sharing, because this qualifies under the region's private noise wall conversion program, it is paid 100% by the region. The difference with the wall that Councillor Demerla was referring to is that there is no existing wall in that location. So it would be building a wall from scratch, and it's under a different program in that type of case. Again, staff are happy to bring back a further report that looks at both cases, that looks at walls that are, gives an update on the inventory that we are currently reviewing on a regular basis and monitoring for condition, and what the timeline for all of those walls looks like, as well as any that have been requested within a certain period of time where they don't exist, and the policies around that as well.
Thank you. My list keeps growing, so I think it only fair I go to Councillor Groves now. Councillor Groves.
Thank you, Mr. Chair. And Councillor Innes made a really good point. And yesterday in my conversation with staff, that was my point, is that the Emilco Parkway was built. We, the Region Appeal, we redirected all the trucks over to the Emilco Parkway. Residents there have not been able to use their backyards because the noise is so the noise level is it's very concerning for them, and the vibrations. I will say that I've lived in this area for many years, and this wall, we've been dealing with it for many years, and residents have raised a lot of concerns. And so the residents don't feel that the wall is in good condition because they've had to replace panels of this wall. In some of the photos, you will see that some residents, the wall, they're bracing the wall with additional posts or whatever they're doing there. So I don't agree that the wall is in good condition because the residents have had to replace those panels. And I recall many years ago, I think it was in the last term of council, staff did prepare a report regarding these noise walls. And this wall was in there because for 2023. And I remember speaking to Gary Kostelik to say, well, can we bring this wall up before 2023, but we decided that we would leave it there. So in any case, based on the discussion, I am happy to move a motion of referral to staff to have a look at all the program, to look at the program and all the projects, and come back to us with a report, a more detailed report on all the walls. So this way, you know, we are not we're not pitting one against the other, or we're going to be basing this on the merits and not a political decision, because I know that my colleagues, and certainly respect my colleagues in Brampton and Mississauga, that they too have walls that where their residents are concerned, whether it's in good condition or it's based on noise and vibrations and that. But I would like to make the point that the fact that we've rerouted a number of trucks on the Emilco Parkway, it has caused a huge issue for those residents that they have not been able to use their backyards comfortably. Whether it's noise, it's dust, it's pollution, it's all of those things that those trucks have brought to those residents, and those homes existed many years prior to the Emilco Parkway being constructed. So happy to, Mr. Chair, move a motion of referral that staff come back with a report on a full report on the program and the projects. And I will say that we've had the same issue locally on the Albion Vaughan Road, where the residents expressed the same concerns. noise. We did conduct an EA, and the noise decibels were actually way above the acceptable noise level by the Ministry of Environment, so anyway, happy to move the referral.
Yes, and as Councillor Parrish touched on it as a deferral, but I wanted to give you the courtesy to speak, seeing as how the mover of the motion has asked for a deferral, and that is non-debatable. I don't know if anybody else still wants to speak to it, but I have a motion of deferral back to staff for all the matters that have been discussed to come back. Do I have any
point of order, Chair Anika? I heard referral, and if that's the case, I'm happy to second it.
Okay, and what is your preference, a deferral or a referral, Councillor Groves?
Mr. Chair, I'm happy to move a referral to staff because I would like to see it come back with a full report on the projects and all the projects and the program. And I think that this would be sufficient for my colleagues, both from Brampton and Mississauga, with any walls that they're dealing with. And so in that report, I'm sure the commissioner will come back with a very detailed report on cost.
Okay, so in having asked for a referral, seconded by Councillor Innes, I still have one speaker. Councillor Demera, did you want to speak in objection to the referral?
Absolutely not. I just want to thank Councillor Groves for graciously agreeing to the referral to staff. I just wanted to make the point that staff, if you could please address the issue of why some walls are fully paid by the region and why some of them are on the 50-50 cost sharing, and so that I have a better understanding, and then we can debate it if it seems unfair, but I'd like to understand that.
Thank you. And to Councillor Kaleshi, who's waited patiently, Michael, one last quick point.
Thank you, Mr. Chair. I'm happy to support the referral. I was happy to support the main motion. It seems like this is there's a lot of work that's going to be going into this, and I didn't hear when this might be coming back to Regional Council. Can I get I know it's hard to nail down a date, but can I get a rough idea on
Good
when?
question. Yeah, Keely and the team, when do you think this might be back to us?
Through the chair, I would expect that in the second quarter of 2022, it's not currently in our work plan, so we will move that in, and we would expect to get back mid-year in 2022.
Okay. I have the motion of referral. I'm taking the vote now. Madam Clerk, I can just call for objections, I believe.
That's correct.
Are there any objections to the whole matter as discussed in all its fullness being referred back to staff? Any objectors to that? Hearing none, that carries. Very good discussion, and I'm glad we're getting a little more information on that. Okay, that moves me down to notices. First of all, before notices of motion and Councillor Sato's notes, is there any other business or councillor inquiries at this time? Seeing none, Madam Clerk, I go to notices of motion, that which was put forward by Councillor Sato and held. 21-1 motion regarding capital gains tax exemption on primary residences. Councillor Sato.
Thank you, Mr. Chair. And considering that an election was called, I probably should have let this go through back in July, but better late than never. So this was just in response to motions that were passed by other municipalities. And it was raised as a concern that right now, anyone selling a primary residence is not paying capital gains tax. And many seniors are counting on their primary residence as income when they sell it, and not expecting to pay capital gains tax. It's not like having a secondary residence that would be a non-essential. So when I read the motions by the other municipalities, and I was concerned that the federal government was even considering this. So I think it is appropriate. It doesn't help housing at all. In fact, there are reasons to say that it's actually contrary to supportive housing or to housing for people that are trying to sell their residence. It was kind of a thing that I wasn't even aware of, but I don't recall reading it anywhere else except the motions that came forward from the other municipalities. So I think we should support it, and I will be asking Mississauga Council to endorse the motion once we've passed it here. So I want to thank staff for preparing the wording for me over the summer. I appreciate that, and because mine would have been a lot briefer if we'd done it back in July.
Yeah. Quick aside before I go, I think all the three main parties have since come back from the edge, and this thing's dead on arrival now because of the election. But be that as it may, Councillor Parrish.
To second the motion, I think it is a deterrent. A lot of seniors would not move out of their homes, and we want to make room for younger families. So I'm happy to second it.
Thank you. It's been moved and seconded. You have the motion before you. I see no other speakers for the vote. Over to you, Madam Clerk.
Any objections?
Hearing no objections, it carries unanimously. Now, to my council colleagues, well done to all of you and the staff. It's just after 12, but I only have the 2 in-camera items. I would like to move along and get you on your way unless a majority of you disagree strongly. I'm going to give it a go. So let's see if we can move in camera. Madam, and thank you for the thumbs up to all of you, or so many of you. I think we'll get it done quickly. So Madam Clerk, if I can turn over to you to properly get us into camera. I know we still have the bylaws, but over to you to keep us moving along, please.
Thank you. We are moving into closed session. As per the rules of electronic participation, each of you must declare that you will adhere to the confidentiality standards as outlined in the Regional Code of Conduct, which provides that no member shall disclose the content of any such matter or the substance of deliberations of the in-camera meeting until the council discusses the information at a meeting that is open to the public or releases the information to the public. If you cannot make the stated declaration or appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place, please withdraw from the meeting until we have moved back into open session. It is recommended that you turn your camera on for the in-camera session. Members who leave the meeting during the in-camera session and attempt to connect back via the dial-in option will be required to send an email to council@peelregion.ca indicating their request to rejoin the meeting. We will temporarily pause the in-camera session and unlock the room to allow you to join. You will be required to identify yourself upon joining the meeting. Do I have a mover and a second to go in camera? Seeing Councillor
Sado and Councillor Starr, motion to move in camera.
Thank you.
Are there any objectors to that? And I've heard none, so we're into camera.
Just give us a second to get back into the public realm.
Yes.
And we are back in public. Thank you.
Madam Clerk, thank you. So I turn to you, Madam Clerk, to deal with what was dealt with in camera, any related bylaws we have to deal with at this time. So over to you.
Thank you. The first motion is that the in-camera direction contained within the confidential report listed as item 23.3 on the September 9th, 2021 Regional Council agenda be approved and voted upon in accordance with Section 239(6)B of the Municipal Act 2001 as amended. That's moved by Councillor Sado and seconded by Councillor Mahoney. Are there any objections? Seeing none, hearing none, that carries. And further, in relation to item 23.4 that was in camera, there's a motion from Councillor Parrish, seconded by Councillor Sado, that the Region of Peel recognize the National Day of Truth and Reconciliation being September 30th annually, and further, that there be a National Day for Truth and Reconciliation paid holiday for all Region of Peel employees on September 30th, 2021. And further, that staff report back on a paid holiday in subsequent years. And further, that staff design and deliver a program to commemorate a National Day of Truth and Reconciliation. Any objections? Seeing and hearing none, motion carries.
Thank you. Madam Clerk, any other matters related to the in-camera?
No further matters relating to in-camera. The balance of the in-camera agenda went on the consent agenda. So
Right.
the outstanding matter.
Bylaws?
Yes, there is the confirming bylaw. So that bylaw 47-2021 to confirm the proceedings of Regional Council at its meeting held on September 9th, 2021, and to authorize the execution of documents in accordance with the Region of Peel bylaws relating thereto, be given the required number of readings, taking as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Moved.
I was going to say, as moved by Councillor Singh, seconded by Councillor Downey. Do I have any objections?
Councillor Singh actually has left the meeting.
Oh, my apologies. Madam Clerk, if you could.
Councillor Dillon, I can move it.
Very good. Councillor Dillon, seconded by Councillor Downey, the confirming bylaw. Nobody in objection, that carries. I have a motion to adjourn from Councillor Fonseca and Councillor Raz. That carries, Madam Clerk. We've concluded all matters, correct?
We have indeed. Thank you very much.
We stand adjourned with thanks to all.